So, welcome to everybody. I declare open this public hearing of the Senate Rural and Regional Affairs and Transport Legislation Committee. The committee is conducting an inquiry into the operation of the Australian Transport Safety Bureau and in particular its report on the June 2017 crash of a flight conducted on behalf of AngelFlight Australia. And I welcome you all here today. This is a public hearing and a Hansard transcript of the proceeding is being made. Before the committee starts taking evidence, I remind all witnesses that in giving evidence they are protected by parliamentary privilege. It is unlawful for anyone to threaten or disadvantage a witness on account of evidence given to a committee, and such action may be treated by the Senate as a contempt. It is also a contempt to give false or misleading evidence to a committee. The Senate prefers all evidence to be given in public, but under the Senate's resolutions, witnesses have the right to request to be heard in private sessions. It is important that witnesses give the committee notice if they intend to ask to give evidence in camera. If a witness objects to answering a question, the witness should state the ground upon which objection is taken. The committee will determine whether it will insist on an answer, having regard to the ground that is claimed. If the committee determines to insist on an answer, a witness may request the answer be given in camera. Such a request may, of course, also be made at any other time. I remind people in the hearing room to ensure that their mobile phones are either turned off or switched to silent. And finally, on behalf of the committee, I'd like to thank all the witnesses here today for being here to give evidence. So, I now welcome representatives from AngelFlight Australia. For the Hansard record, could each of you please give your name and the capacity in which you appear today?
Thank you, Senator. My name is Marjorie Pagani and I'm Chief Executive Officer and a Director of AngelFlight.
Benjamin Morgan, I'm a Liaison Officer for AngelFlight for AOPA Australia.
Owen Crease, I'm a volunteer pilot with AngelFlight and their volunteer safety manager.
Thank you. So I invite each of you to make a brief opening statement before the committee asks questions. Do you wish to make an opening statement?
Yes, please, Senator. Thank you. Firstly, on behalf of AngelFlight and personally, it's important for us to acknowledge the immense tragedy of these aviation accidents. We're here, generally speaking, out of respect and to honour all of those touched by them, but importantly, to ensure that the safety message arising out of these accidents and any subsequent reports or rules is done properly. We want to make sure we get it right for them and the aviation community into the future. That is fundamental to our welcoming of the opportunity this committee has given us today. Firstly, if I may, briefly in relation to the ATSB report, the primary issue we take with that is that it is wrong, it's dishonest, it's misleading, it uses inventive and flawed data sets, and it targets unfairly a charity and does nothing to investigate the accident, nor in the future to give any guidance or recommendations into how this sort of thing can be prevented in the future. These were human factors accidents, as are most car, boat and aircraft accidents. That hasn't been investigated. We have a very, very small percentage of a report that effectively says a pilot took off in poor weather, lost control and fatalities occurred. We know that that is sadly a very common accident in aviation across the world, but certainly in Australia. There is nothing in the report whatsoever that assists pilots with guidance, training, or future reference to prevent this happening again. It is, and it's always been, set out to be an attack on this charity. At the accident scene in Mount Gambier, the lead investigator with no experience in aviation stood before national television and said, "We will be investigating AngelFlight," and that's what happened. That was at a time, Senators, when the ATSB had not even given AngelFlight the courtesy of a confirmation that this was an AngelFlight related accident. I can tell you that I received the call from our senior flight coordinator. We flight track all the flights. It was clear from flight tracking there was an issue. The track had stopped. Immediately, I called South Australian Police, the ATSB and CASA, gave them all of the details of this flight, the persons on board, their relatives, how they could be contacted in the event that it was as it seemed to be. I was unable to do more at that stage because I was told by the Mount Gambier manager of the airport that 2 aircraft, light aircraft, had taken off within 1 minute of each other. I was there with the relatives calling me saying, "Is this our family?" I had to say, "It doesn't look good, but I can't confirm that because I can't get any information back from the ATSB." And at that time, we had the ATSB investigator telling Australia that it was our flight. That set the standard for this investigation. It was a result that was predetermined and the figures were matched. And that comment, not in those exact words, was made by our very senior statisticians who have examined all of these, and those reports are with a bundle that's sadly been sent late to you all. We also had an analysis done of those statistics which revealed the same. In effect, what the ATSB has done is to select a portion of the flights, certainly less than half, on the basis that they are not interested in flights that are arranged by AngelFlight, where the coordinated by AngelFlight, where the fuel is paid by AngelFlight, unless there is a passenger on board. We have represented to them that if, as they urge us to believe, there is, in their words, a perceived pressure for pilots completing these flights, we have said to them, well, if that is so, surely the pressure would be existing when the pilot departs to pick up the passenger, to get the passenger to take them to their appointment. And they said, no, we're only interested when they've got them and they're bringing them back. It's totally artificial. We have approximately, at that time, about 46,000 flights, and that doesn't include pilot relocation sector flights. That is just out and back to get the passenger and to bring the passenger, not often a third sector where the pilot goes from his base to the pickup spot. So we haven't counted those. So they have deliberately cut out half of those. At a meeting with the ATSB, this has been obviously raised. The draft report did not mention any data relating to our two-sector flights. The ultimate report did put that analysis in. It had been done, but not included. I asked Mr. Hood at a meeting why he had headlined this huge discrepancy between these charity flights and others when their own data, their own analysis revealed that had they used all our flights except the pilot repositioning, we would have the same safety rate or better than private general aviation. His response to me was that if people want to see those facts, they can dig through the appendices of the report. Of course, to which I responded, people will only read the headlines and you know them to be wrong. And indeed, I raised at that time that the report was dishonest. It is based on an assumed pressure, but Senators, I want to make it very clear that at no time did the ATSB nor CASA, before they did their rule set, at no time whatsoever did they approach us and ask us, could we have a list of names of your pilots or health professionals or passengers or drivers to talk to about this. Clearly, I wouldn't have given names of patients, etc., without their consent, but I certainly would have asked those people, here's a number, ring the ATSB if you want to talk to them. So they came to this view on pressure without talking to a single solitary participant in this whole event. Certainly in the final report, which wasn't in the draft, they did acknowledge that AngelFlight puts no pressure on pilots. So they moved to this perceived pressure on pilots. What they also didn't do is they counted 10 years of flights, not hours, and senators had the hours been counted. Our studies reveal that our statistics would be as good as charter. But what the ATSB did is it counted flights, totally in opposition to its own protocols. And that will be in the summary when you have a chance to read our overview, the direct quotes of what they should have done. By doing that, they're saying that a joy flight around Sydney Harbour for 10 minutes is the same as a trip from Sydney to Lightning Ridge and back, or Adelaide to Maree or Birdsville and back, or a circuit, non-training, currency. We all have to do circuits sometimes for touch and goes practice. That takes between 4 and 6 minutes depending on your aircraft. So they counted those flights the same as a flight halfway across the country and back because they refused to count flight hours. That is totally at odds with what they should have done. The other, at least certainly in the final report, they did change one other aspect where they had originally said we offered no guidance to pilots, and they changed that to insufficient. But nowhere have they told us what is sufficient. What they've done is they've said to Australia, AngelFlight should not exist in its current capacity. It should use jet transport. It's a very important statistic they've missed out. They didn't count 2017 accident statistics for the rest of GA, only for AngelFlight when they did their comparisons. And I can tell you, it's acknowledged by the ATSB that in that same accident year, 2017, there were 22 deaths in commercial aircraft in Australia out of 14 accidents. And nowhere do we hear the ATSB saying to commercial operators, you have a duty to tell your paying passengers that they should not travel on our charter aircraft because RPT is safer. But that's what they're saying to us. And Senators, what is really important here for both the ATSB and CASA is to acknowledge the difficulties of people in rural Australia. By saying they should all catch jets, they have absolutely no idea what it's like. It's not just about, are you an hour or so from an RPT airport? Surgeons, hospitals, they don't work to RPT timetables. We have people in far western Queensland, they have wheelchairs, they have special seats for babies. They say to us, even if we could get an RPT flight, what happens when we get there? Certainly the airlines are very helpful at getting us off the aircraft with disabilities. But then we're faced with a big city airport, with a wheelchair, with special baby seats for the cerebral palsy children, etc. Then we've got to find a waiting point. The driver, if we provide a driver, even for an RPT flight, they can't leave their car. They're somewhere around Sydney Airport waiting. And these often elderly people or people with young children have to find their way with all their equipment and bags and chairs and wheelchairs to where these people are. It shows a total lack of understanding of rural Australia. And what our feedback is from our passengers, and some of the feedback you will have in your bundle of documents, is why is a government agency treating us like idiots? Why are they saying you cannot choose how you get to hospital? We are telling you you should not be choosing these private flights. And you will have the documents in front of you for a later reading. You will see how well informed they are. And in addition to all of this, there's a formal briefing by a flight coordinator, and they must watch a video signed off by their health professional which shows the smallest of the aircraft we use. We don't put the Citations or Cheyennes or King Airs on there. We put four-seaters on there so they know what they're flying. What they're saying is the people in rural Australia are too stupid to understand, notwithstanding the documents, the video, and that they live in the outback where light aircraft flight is a given. They're too stupid to know they are not flying in a jet. That's what they and the Civil Aviation Safety Authority are saying to the people of rural Australia. And certainly AngelFlight looks to the Australian Parliament to rectify this and to stand up for these people and allow them to make what are very, very well-informed choices, and to make those choices knowing that this data is misconceived, deliberately flawed, and has decided on an outcome and used the statistics it wants. What AngelFlight would like to see is a withdrawal of the ATSB report, a proper expert investigation into the accident. If there needs to be, and if this committee or others in the Parliament think there needs to be an investigation into charity flying, then so be it. We will cooperate, as we have done, above and beyond our call of duty with any investigation. But it should not be merged and focused on instead of an aircraft investigation. We have been urging CASA for many years to enhance its human factors training, pre-licence. Certainly one can attend seminars on a voluntary basis, post-licence. As you all know, we rely on CASA, its training, its licensing. If CASA is saying these pilots are dangerous, CASA is also saying we don't provide proper training. Our pilots are dangerous. Are we not entitled to rely on them? And bear in mind, the standards that we set are far, far higher, certainly before the accident, than CASA has ever required. And even now, for example, 250 in command, they didn't change that. A pilot can get a commercial licence and fly passengers in 70 hours, total time, total time. We say, and have always said, 250 in command. So is CASA saying to us and the public, we don't trust our training system? They must be saying that. But they've imposed rules which do not at all reflect in any way these accident causes or indeed any real accident statistics. I challenged Mr Monaghan about this when he came to my office on the 28th of November 2018 with a hastily scribbled bunch of notes and said, we're going to propose these new rules, they'll be published in 5 days. I'd been working with CASA for 1.5 years. We had initiated safety training, mentoring, which CASA has now stopped. We had been putting into place a lot of safety procedures, which really were the responsibility of the regulator, and at no time were our plans criticised. They certainly said they'd like to see us move more quickly. But at no time did they ever mention this new set of rules. It was presented to me, well, not shown to me, but told to me on the 28th of November. And I said to Mr Manham, what does this have to do with the accidents? It has no relationship to them, these rules. He said to me, I agree, it isn't related, but we have to do something. That was one day after they'd received a call from the ATSB asking, what have you done since the accident? No proper protocols were followed. The minister here, sadly, has been grossly misled by CASA. He's been told that there's been public consultation. You will see in your bundle of documents there is about 10 pages of protocols for consultation that CASA is supposed to follow. It didn't follow any of them. He's also been misled in that, and I spoke to Mr McCormack about this, Mr McCormack had been told by CASA that they were only following the FAA. That is totally 100% wrong. Private flights in the USA are not regulated. We follow the model of California, US AngelFlight West, the biggest operator, which is private flights, no regulations. So there are so many ways that they have misled the minister, which is really unfortunate, and I blame not the minister. That is the responsibility of CASA to properly inform the minister. What we would like to see, and I hasten to add, when I challenged Mr Carmody at a meeting in Canberra with various CASA and our directors present about why he was not following protocols on this, Mr Carmody's first answer was, well, I have the power, that is, to issue an administrative directive without going through the protocols. I pressed further, and Mr Carmody's answer was, well, Marjorie, because it's easy. That's what he said in front of his senior executives and me and one other director of AngelFlight. And really, what CASA hasn't done, which we would welcome, is to get rid of this ridiculous document that does not address any safety issue whatsoever related to these accidents and most, and send it to where it's supposed to be, to advisory committees, to industry, to proper industry consultation. CASA says we went to industry consultation. We set out this consultative document a few days before, not a few days, a few weeks before Christmas. Then the responses came in within 3 working days after the responses, huge number of responses. They had the rules published. Well, that seemed a bit odd. But how reliable are they? And Mr Greg Hood from the ATSB has also read these and clearly relied upon them because that was raised at our last meeting. I have added to your documents just one example of these submissions where a commercial pilot or ATPL, commercial airline pilot, corporate jet pilot and very experienced private flying pilot put in a very lengthy submission, 5 pages. What came out from that same person on the website, and you have this in your bundle, and I won't mention any names, is 4 lines. That was said to be this person's submission, 4 lines.
On whose website?
CASA. They've published the Community Service Flight Consultation Hub. So how can we or they rely on them? These are not identifiable documents. Mr Hood has relied on them as well. It's just absurd to do that when they could have talked to seniors in industry, to the people who are involved in this, the passengers, the pilots, the drivers. They didn't talk to anyone, neither CASA nor the ATSB, and nothing in their website is verifiable. But more importantly, when they've told the minister that they've done this consultation, feigning transparency, nowhere have we ever seen an analysis of all these documents. What did they say? Well, our analysis shows they certainly didn't say there should be rules, anything akin to what CASA put out. And even in the ATSB report, the only reference to the new rules was a lauding of the policing factor. We now have to write that in our logbooks. We have to put it in our flight plan. Well, they could ask us if they wanted to. They never did. And I realise I've probably gone over time, so
I just want to give you the committee opportunity to ask you questions.
Yes, and I'm sorry. I shall leave it there.
All right, thank you.
I think we got the picture.
Mr. Morgan, do you have anything that you want to add briefly?
I won't rehash or go over the issues, I guess, that Marjorie has raised, other than to say that this report, it is critical that this report is actually rescinded and that a new investigation be undertaken and potentially and more broadly, a larger investigation into the totality of it, because the outcome of this report, what this report drove regulatory changes that have a direct impact on the industry, regulatory changes that have applied a great deal of negativity towards the overall safety culture of general aviation pilots and our aircraft maintenance standards. And as I said from the outset on this issue, and we made, obviously through AngelFlight and also AOPA, absolutely nothing that CASA have put forward would have prevented either of the two accidents from occurring. And I think that this is the critical point. We are here today because two pilots, on their own volition, in total contravention to the civil aviation regulations, in total contravention to the procedures and processes of AngelFlight, took it upon themselves to make decisions that resulted in fatality. And AngelFlight's now bearing a huge punishment for those individual decisions. Pilots who are trained and licensed and regulated by our government aviation regulator, and the industry's paying a price. And so to allow a report to drive a regulatory change that does not directly address the root cause of both of these accidents, which is identical, human factors, the human condition, the same principal reason we have fatigue fatalities on the road, we have alcohol fatalities on the road, we have speeding fatalities on the road. To allow that regulation to stay in place, to allow that report to stay in place, I think would be an enormous travesty. So I really do urge the government, I urge our senators here today to listen to what AngelFlight has to say, because it is based in truth, and all we are interested in achieving is achieving outcomes that genuinely benefit safety, not pay lip service to it, not pretend to do something for it, but to actually address safety. So,
Thank you. Dr. Creese?
I'll be very brief. I just want to refer briefly to a couple of issues related to the statistics, because I was one of the people who did a fairly detailed analysis of the accident statistics on behalf of AngelFlight. Mr. Bacani mentioned some of the misleading information that was provided by CASA in regard to the regulations, where I think at Senate estimates, CASA said that it's 4 or 5 times less safe to fly with AngelFlight than to fly with your mate. And I believe that data was obtained from the annual aircraft activity survey carried out by the Bureau of Infrastructure, Transport, etc. I'm not sure how they managed to do that, because that survey has only been identifying community service flights for since 2014, so a 4-year period compared to a 10-year period. But on top of that, there is nothing in the aircraft logbook that records the purpose of a flight. So I don't know how a pilot is meant to, or an aircraft owner is meant to identify how many hours or how many flights his aircraft has done when it's not recorded in the logbook. If you look closely at the data, in the 4 years from 2014 to 2017, that activity survey showed an average of 46 aircraft reporting that they did community service flights. AngelFlight's own records show that in each of those years, more than 200 different aircraft were involved in community service flights. So to extrapolate from 46 aircraft in 4 years to 200 plus aircraft over 10 years is a bit of a stretch to me. What's more, the Bureau's definition of a community service flight is a very broad one that would include organisations such as Little Wings, Fun Flight, any local aero club activity that's doing a charity event. They're all captured by the definition, but that's not the definition used by CASA in their new regulations, so there's a big mismatch there. In terms of the ATSB data, there's a statement early in their report that says their objective was to understand the risk to passengers. So they have selected passenger carrying legs from AngelFlight, compared that with all other private flying. Now, it seems to me that it's fairly difficult to have a risk to a passenger in a flight that doesn't have a passenger. And there's an unknown proportion of general aviation flights that don't carry passengers. The fact that you don't have matching data is no justification for doing the comparison between passenger flights and all flights. There's quite a number of other differences which can be identified that would make the comparison dubious, if not invalid. As a result of our discussions with ATSB after the draft report was issued, they have included some further information, further analysis in the final report, including counting the empty sector in the AngelFlights, which more than doubles then the number of flights that they counted. When you do that, then the difference in accident rates between AngelFlight and other private operations is insignificant. They're almost the same number. If you do that for fatal accidents, again, you get a slight difference which is statistically insignificant. That information appears only in the fine print of Appendix B in their report. Their headline statement, as Mrs. Pagani said, is based on the passenger leg only, which they claim says we're 5 times more or 7 times more dangerous. So to me, there's so many deficiencies in the analysis that it's not really it's not useful to us as an organisation trying to identify safety features or risks. In terms of occurrences, these are things that happened that weren't accidents but could have had some impact. When you look at the group of occurrences that ATSB said AngelFlight features most prominently in, almost all of those occurred in controlled airspace. So, and in fact, that's exactly what you would expect to see because all of our flights operate in controlled airspace. There's some unknown proportion of other general aviation flights that never go near controlled airspace. So I don't see how you could actually say AngelFlight is better or worse when you're not comparing the same things. I think that's sufficient on the stats at the moment.
Excellent. No, that'll give the committee some time to answer some questions, give you some questions. I did just want to ask you, just to clarify, Marjorie, that you said the consultation sent out a few weeks before Christmas. The final report was published 3 days after consultation closed. Which consultation?
Oh, I'm sorry. That was the CASA consultation hub. When Mr. Monaghan visited me on the 28th of November with his scratched notes about the proposals, he said we will have these published within 5 days. However, they did give more consultation. It was over the Christmas period, so it was certainly a bit over a month from my memory. But then on the closing day of consultations, within 3 working days of that, the rules had been struck. And I can tell you, Senator, how I found out about that is because the chairman of the CASA board did an interview with ABC Television Rockhampton to tell them of this. They hadn't told us. And that young lady called me and said, look, here's a statement by the head of the CASA board. Did you know anything about this? And I said, no.
That was the 28th of November, what year?
Yes. That's when I got...
so what year?
Sorry, 2018.
All right.
I'll pass my time to Senator Patrick if I can, Chair.
Senator Patrick, would you like to start?
Yeah, thank you very much, Chair. You said in your opening statement that you didn't think the report covered off on the accident, but it actually does go through the accident in quite goes in quite detailed reasoning to the cause of the accident, and I think it's safe to say that it says that the pilot, in using poor judgment, took off in flying conditions in which he should not have done so. So I understand you have objections to the data and the report in respect of AngelFlight, but are you okay with what has been done in terms of the forensic analysis of the flight itself?
Senator, there hasn't been a forensic analysis. Certainly we don't have any issue with the facts, but the facts were there. Anybody standing on the ground would have come up with the same facts. Pilot took off in bad weather, not exercising proper judgment. Same pilot clearly, unless there was a medical event and that wasn't examined, was not complying with the regulations that he's supposed to comply with, lost control and crashed. They are facts. We don't dispute those facts. That is not a forensic analysis. There is none in that report. What needed to be done is look at the history, look at the background before this accident, whether it was the aircraft, the pilot, any history that would enlighten us on that. But more importantly, where are the recommendations?
No, I understand the recommendations
but yes,
are
sorry,
lacking.
No forensic analysis was done. It was simply a statement of facts, and we have no issue with those facts.
Okay, but in your call to rescind the report,
yes,
you would accept that the facts as laid out
yes,
in relation to the flight are correct?
Yes.
And that work does not have to be redone?
No.
Okay.
So, Senator, could I just add briefly to that? One of my concerns as a pilot with that, the analysis of the accident itself, is that it really ignores the steps before that. I mean, like most accidents start a long time before the accident itself occurred. This pilot left Murray Bridge and to fly to Mount Gambier on a day when clearly it wasn't appropriate for a VFR pilot to fly to Mount Gambier. He was scheduled to fly back to, or planning to fly back to Adelaide, and the weather forecast for Adelaide on his arrival time was clearly not suitable for a VFR arrival. Now, I happen to know that as an absolute fact because I was scheduled to do an AngelFlight into Adelaide on the same day and cancelled because of the weather. So there's a lot that surrounds this accident, which is valuable information that hasn't been considered.
Okay, thank you. You say in your testimony that normal protocols, I might just direct you, Dr. Crees, is that the normal protocols were not followed in respect of the way in which you do analysis on a flight. So starting from the pre-positioning flight through to the carriage of the passengers, and then presumably getting the aircraft back to its original location. What protocols are they in breach of?
Well, the two issues there are, first of all, the positioning flight, where the empty leg, if you like, is organised by AngelFlight. The pilot is under pretty much the same pressure, whether he's got passengers or just getting to the passengers, and that's a key part of the ATSB, analysis. The second is the use of flight numbers rather than flight hours, because as far as I can find in all other ATSB accident analyses, the accident rates are based on rates per 10,000, 100,000 million hours. They're hours-based calculations. For some reason or other, this report has reverted to flight numbers.
Okay, but you say there's a protocol that's in place that would normally be used in aviation to count those pre-positioning flights. I mean, I get that. In my view, that's the case, because that's when fatigue would commence. Any fatigue analysis would commence, wouldn't it, from the very first time that the pilot goes to the aircraft to open the door?
Well, yes, the entire trip is under the same pressures and challenges as the passenger leg.
Okay, but is there a protocol?
Senator Griffin.
Thanks, Chair. Sorry, Senator Patrick, I just want to clarify. So, Mr. Cruz, by ATSB using amount of flights the pilot had performed in his career rather than ours, did it make it look like the pilot was less experienced?
No, this is the analysis of accident rates that we're talking about. So it's
not just this one?
No, this is the overall analysis of accident rates.
Okay, all right, thank you.
Which of course leads to your major concern that the ATSB in effect has gone with a headline rather than looking at the total number of flights. So obviously we'll be asking them as to why they might have done that, which is why I'm trying to identify some international standard or some protocol that would require them to do so.
In terms of flight numbers, the ICAO recommend flight numbers, but that's only for commercial transport flying. They an aircraft above, I can't remember the weight, 2,200 kilograms or something. It might be 5,000. So basically for airline flights. ATSB and all the reports I've seen use hours, not flight numbers. The NTSB in the US also uses hours, not flight numbers for general aviation. So here we have just one particular analysis which is out of sync with everything else.
Okay, so we'll put that to CASA.
I think, Senator, to clarify, I think I might understand where you subtly might be going there, and that is if this accident hypothetically was a commercial charter organisation and the ATSB were investigating it as an accident, then there would be a fair assumption that in collating the data, the ATSB would be looking at the total flight, not just a portion of the flight, i.e. one sector of the flight. They'd be looking from the moment that the pilot clocks on to the moment that the pilot clocks on and all of the legs he may have flown or she may have flown, if I'm to understand the question you're asking.
Yeah, well, I'm just trying to identify, is there an international standard? So clearly a choice has been made about what statistics to use, and it's a case of lies, damn lies and statistics. You can always pick whatever suits your case. I want to know if there's an international standard in relation to the examination of these sorts of operations and what should properly be used.
As far as I know, for general aviation, there is no international standard. There's a common practice, which is hours.
Ms. Begani, you've indicated that the ATSB in some way had a preconceived idea that they wanted to direct this at AngelFlight. How did you come to that conclusion? Is it through communications or just an observation of a number of data points?
It's part of a story, a continuum, Senator. It started on the airfield with the lead investigator, arms folded, saying, we will investigate AngelFlight, as I said, before they told us about...
So that's in relation to the second crash in 2017?
That is so.
Was there any activity prior to that, after the 2013
No. We had,
crash?
of course, an investigation in arising out of the 2011 accident,
right.
And that... in that ADSB report, no responsibility was found to attach to AngelFlight. There was also Victoria coroner's finding to that effect, that there was no responsibility to be laid on AngelFlight. What the ATSB did here is to resurrect that, notwithstanding they never appealed the decision of the coroner's court or did anything about their own report. They never disagreed with their own report, but decided to drag that up and include it in this. And so it became, in my view, a witch hunt against AngelFlight, and totally contrary to the ATSB's initial findings in 2011 and the Victorian coroner, which is never appealed. So that decision stands. But the ATSB has sought to rein all that in as an attack on AngelFlight. I have had, of course, many...
What's the motive?
It's difficult to know what the agenda is, other than trying to show they've done something, similar to what Mr Monahan said. Hey, we've got to do something. Doesn't matter that it's not relevant, but we have to do something.
You've had conversations in the way in which to improve AngelFlight safety. I presume you've had those sorts of discussions?
Yes. Look, Senator, what we did, similarly, we went above and beyond with the ATSB, I can tell you, because under a summons we only had to produce our data, which really was in spreadsheet form. We didn't have very sophisticated reporting access, so we agreed to have our IT person write the code for the whole 10 years of flights, so they could then run that through Air Services and CASA data to save them.
But sorry,
a
that
lot
goes
of
that
work.
goes to cooperation with the ATSB. But in terms of just analysis of how you looking at the accident in 2011 and 2017, and maybe internally looking and saying, well,
Yes.
how do we deal with this?
What we did, and I suppose this goes back to CASA, again, immediately after the accident, in August of that year, I invited CASA into our offices. Now, we're not an AOC holder, we didn't have to do that. But in the spirit of trying to work towards safety reform, I invited, and a team came into our office. We showed them, we gave them our documents. We couldn't let them access directly our computers because we have patient files on them. And we sat with us and our chief flight coordinator to answer any questions they might have. And I suggested then we start to work, and we work with CASA. What I would have liked is a partnership. Indeed, Mr. Monaghan, in those early days, after reading our documents and procedures, said to me, "This is very impressive. It looks like a military man wrote it," to which I didn't take offence. However, there was no criticism of the way we do things. We did, however, say, look, these are the things that we'd like to do, and we were greatly assisted by US AngelFlight California. And so we then started on the process of writing the script and so on for an induction course. It's been a big procedure. We've now filmed it. In the meantime, to get the US AOPA course up, and it's required for our pilots, we put in place a mentoring program for pilots. CASA has stopped that.
Now, they've stopped that through the new regulation that's come into force.
They've
that
stopped
doesn't-
it through that,
It doesn't
yes.
allow a mentor on the plane.
No,
it only
it says
allows a
operating
passenger.
crew.
Yeah, okay.
Indeed, we have a letter from Mr. Monaghan that says it must be a person endorsed on that aircraft. Well, that's not the CASR definition of operating crew. It's basically a person appointed by the pilot and command with a duty in relation to the safety or operation of the aircraft, such as a load master or a navigator. So Mr. Monaghan's wrong. It doesn't have to be an endorsed pilot. But what the purpose of the mentoring is and is to take a pilot. It doesn't have to be endorsed on the same. I might have somebody in a Cessna 172 goes along with the guy in the TBM 850 to observe how the safety culture works, the procedures, the sort of things they might experience with the passengers getting on and off who have disabilities and the like. But importantly, to observe that even an experienced jet pilot, if he doesn't like what he sees up the front, will pull the levers back and say, no, we're not going, ring AngelFlight. We take over. The pilot doesn't have a responsibility with the passengers. We wanted them to observe that if an experienced pilot is happy to pull the power back on the runway, then it's okay for the junior pilot to see how there's no pressure. We've had to stop that because we cannot honestly say that pilot being mentored is operating crew for that aircraft. Most people, if you get them on your airplane, you get a stranger next to you in the right seat, you're not going to let them take the controls. That's just...
Mr. Morgan, have you ever been asked how to
Well,
help?
Senator, I think that it's actually a very interesting question because about 2 to 3 weeks after the 2017 accident, I had a meeting with the board at AOPA Australia, and I discussed at the board that we seem to have a recurring theme within aviation of inadvertent flight into IMC by VFR pilots, and it results in fatalities. IMC, instrument meteorological conditions, entering into cloud and not being able to see what you can do. It's a worldwide phenomenon. It's not limited to Australia. It's not exclusive to our airspace. It happens in all aviation regions where there's general aviation aircraft. Light aircraft pilots fly into cloud, and if they're not appropriately trained, they have but a few seconds to live. And our organisation's written quite a number of editorials about this. I reached out to our Industry Stakeholder Relations Manager, Mr. Rob Walker, and I informed him that I'd had a conversation with our board and that we felt it would be beneficial to the industry if we worked together in developing some kind of guidance process, information process or awareness process, an educational resource. And one of the reasons I had brought this up is that AOPA Australia is part of a global AOPA community. We're the world's largest general aviation advocacy, and AOPA USA has the world benchmark on community service flight education resources. And I believe that AngelFlight's been working with AOPA in the US to leverage from those. And I put the offer to Rob Walker that we would like to work with CASA, and I was just told, no, we're doing our own thing, but if you really feel compelled about it, you could write to us. Now, I didn't bother following it up after that because I knew what that comment was. That comment was, you don't agree with everything that we do, we don't want to work with you, we'll go our own way, thanks. And so I walked away, and my report back to the board was that CASA are playing politics, they're not serious about safety, because if they were deadly serious about safety, they would have taken that invitation and they would have said, Ben, let's do something, let's get it happening. And so CASA have gone it alone since 2017, and they run their pilot safety information seminars, and not a great deal of people turn up to these seminars because broadly across the aviation industry there is a significant chasm of distrust, a vacuum of trust between the industry and CASA. So people don't generally like to go along to these things and interact with them. So CASA aren't actually communicating with the industry. They're not actually supporting the industry. There's a veneer of it. That veneer is enough for them to hang their hat on it so that they can claim to the minister that they're doing these things and there's a commitment. But the dirty little secret is that these programs and these initiatives are they're just not delivering results. And so we would, despite the politics, we still remain entirely open to working with CASA, and we would embrace that opportunity, and we would do everything we can, because ultimately we want to eliminate fatalities in aviation. And I think if we go right back to the very start of this, we had 2 pilots who maybe, if they had been given some support, maybe if there'd been some appropriate information and awareness from the regulator, maybe those decisions wouldn't have been made. But what I do know, and what I would be willing to lay my professional career on, is that there is no amount of paperwork that CASA can generate that will ever stop a pilot sitting in the cockpit where CASA are not from making terrible decisions. The writing on pages does not oversee a pilot in the cockpit. His education, his training, his currency, and the support he receives in the industry is what keeps him safe.
All right.
Thank you. Thank you, Chair.
Senator Rennick, do you have a question?
Just a few, Marjorie, if you don't mind. So, how many lives do you think AngelFlight has saved?
Good question.
We've
Or-
transported about 100,000 people.
Yep.
And Senator, I can tell you that, and I move around the country, and I talk to little groups in mid-Western Australia and all over the place. And I have people saying to me, if it were not for this service, I would not go. I had an 84-year-old lady south of Geraldton, where I drove a few hours south of Geraldton, and she said, I've been driving to Perth for my cancer treatment. She said, but I can't do it anymore.
Yep.
We take her. I have people in the middle of Western Australia from Aboriginal communities. They don't get their gynecology and obstetrics checkup, so babies are often born with problems. We now bring them in from all corners. I have these comments all the time. We just couldn't do it. We can't face city airports. We're in our 80s. We're just not going for treatment. And Senator, that is one of the reasons I would have liked both the ATSB and CASA to have a real look at what is happening in rural Australia, because they don't know.
I'll just support that statement. I've just been around rural Queensland for 2 weeks myself, and feedback about AngelFlight was fantastic. Nothing but good things was said, and I myself am from Western Queensland, so I know that flying is not a luxury; it's an essential service. And just one other question: so the pilots volunteer their own time?
They do.
So they basically, the intent is there to help people.
they do it to their time, their skills, their aircraft.
Yep.
And Senator, you would know from being in the bush, the cost of an aircraft, not including the cost of buying it,
Yep.
cost of running an aircraft is about 1/3 is fuel. So we reimbursed up to their 1/3. We have a fuel capping system,
Yep.
and they pay the rest, as well as the buy-in cost and a lot of time. I have one particular pilot who flies a jet aircraft in Moorabbin, who hires it, he doesn't even own it. He's just reaching his 1,000th flight.
That's fantastic.
Probably about $700,000 or $800,000 worth of aircraft hire, and Dr. Crease is about to do his 500th flight. So these people are giving so much, and you know what, Senator? They're not the yobbo, inexperienced mob that CASA and the ATSB would have us believe. We have about 50% commercial or ATPL. Indeed, this submitter, he's one of the accidents referred to in the ATSB, a gear up landing, faulty gear light, says gears down, gears not down. So that's one of our accidents. He's a 25,000 hour airline and other pilot. So what they'd have you believe, both CASA and the ATSB, is this bunch of yobbo private pilots out there with shonky machines who don't know what they're doing. Let me tell you, Senator, all of us who own our own aircraft look after them very well. We fly our families. We don't want to have accidents.
Yep.
It's quite different from some, not all, some commercial operations where it's important to make a dollar. Well, it isn't with these people, and I can
It's a
tell
refreshing
you,
change, yeah.
there are 210 owners where might have a $200,000 or $300,000 aircraft with another $300,000 panel on them.
Sure.
These are not yobbo pilots.
Fantastic. Thank
All
you.
right. Senator Sterle,
Thanks,
do
Jim.
you have a question?
Yeah, just a real quick one, because when I was reading this on the plane yesterday coming over, it sort of, the first thing that hit me in the head was that, you know, the different figures that had been used by the ATSB when they were doing the inquiry. So since the inquiry's come out, has AngelFlight, been inundated with calls or letters saying, whoa, we're never going to use you again? What's been the sufferance
Not
apart
one,
from, sorry, Miss, I know Miss Pagnini, how pressed that you are, apart from taking it to heart that it's not the case?
Sorry,
So have you been inundated with people going, oh, bugger me, we'll never get on an Angel Care flight?
not one. But I have got a lot, hundreds of letters of support, emails, phone calls to say, we use this service, we feel very safe. And again, Senator, why didn't they ask some of these people, are you properly
Well,
briefed?
we're going to
Are
ask,
you
we're going to ask
informed?
as soon as you're finished.
And it's been quite the opposite. There hasn't been, even the health professionals out there, and they're the core of this, they refer people. We've had a tremendous amount of support. They're saying, what will these people do without you? These people trust you. And really, they are very well informed about what they're doing.
Senator, if I could just quickly add to it, just industry-wide, what there has also been is an enormous body of response from general aviation pilots across the
support of
industry
Angel.
who are asking the question, why has no one contacted me to ask me about my experiences, the flights I've conducted, and whether I ever felt that I was under unnecessary pressure and would do something stupid? There's a lot of pilots scratching their heads going, why has no one reached out? Why are we having our regulator telling us what we're thinking, and yet we've never been actually interviewed to provide that thought? So there's a lot of that going on.
All right, look, and just to follow on from Senator Sterle, one of the many reasons that we are having this hearing today is because of the outpouring of concern from regional Australia. The number of people who have contacted members of this committee privately and publicly through organisations like the Queensland Country Life, where they and the Courier Mail in Queensland have expressed their concerns about this essential service for regional Australia. Because no matter what you might think, if you're based in Canberra or Sydney, commercial flights are not a viable alternative. I would also remind members of the audience that if you are here to observe and to be respectful. of evidence given by other people. Thank you very much for your evidence today.
Thank you, Senators.
I think I missed something there, but someone's in the shit.
Yeah, we go through. And I just invite you to stay to observe the rest of the evidence. Thank you.
Oh, was it? Oh, okay. Making that. Oh, okay. Appreciate it. All right. Get something like that. Love your style.
Welcome.
Thanks, Senator.
Just before we start, can I check if Senator Brockman is on the line?
I am on the line, Chair.
Indeed, I'm very pleased to hear you. All right. I welcome representatives from the Australian Transport Safety Bureau. I remind senators that the Senate has resolved that an officer of the Department of the Commonwealth or of a state shall not be asked to give opinions on matters of policy and should be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. This resolution prohibits only questions asking for opinions on matters of policy, but does not preclude questions asking for explanations of policy or factual questions about when and how policies were adopted. Officers are also reminded that any claim that it would be contrary to the public interest to answer a question must be made by a minister and should be accompanied by a statement setting out the basis for the claim. For the Hansard record, could you each please give your name and the capacity in which you appear today?
Nat Nagy, I'm the Executive Director at the Australian Transport Safety Bureau.
Thank you.
Patrick Hornby, Manager of Legal and Governance at the ATSB.
Thank you.
I'm Greg Hood, I'm the Chief Commissioner and Chief Executive Officer of the ATSB.
I'm Stuart Godley, Director of Transport Safety at ATSB.
And Chris Manning, Commissioner of the ATSB.
Thank you. I invite you to make a brief opening statement before the committee asks questions. Do you wish to make an opening statement?
Yes, please, Senator, and congratulations on succeeding Senator Barry O'Sullivan as Chair.
Thank you.
And if you're happy, I'll commence.
Thank you.
So we're grateful for the opportunity to explain our findings and methodologies from the investigation into the collision with terrain at Mount Gambier on the 28th of June 2017 of a light aircraft conducting a community service flight on behalf of AngelFlight Australia. On behalf of the ATSB, I'd like to reiterate our deepest sympathy to the family and friends of the pilot of the aircraft and to the family and friends of the teenage girl and her mother killed in this accident. This is why we investigate, to help prevent future similar accidents. Given that this investigation involves a community service flight undertaken for AngelFlight, let me also state that the ATSB has great empathy for the role that the organisation plays in providing transport to make life better for people in rural and regional areas with health issues who need to travel to the city for a medical appointment and treatment. I'd also like to add that this report is not a slight on the volunteer pilots such as Dr. Crease, who conduct these flights daily and for the majority of the time safely. Our intent is to work with organisations who have the ability to allow this to continue as safely as possible. It is those rural and regional people who are at the heart of the safety actions that we're encouraging AngelFlight and CASA to take, so that they're not exposed to unnecessary levels of risk as passengers on community service flights. These safety actions are achievable: training, education and ongoing support for pilots, the reporting and analysis of safety information about community service flights, and considering the use of commercial airline flights ahead of private flights when circumstances permit. We're pleased that some safety action has already been initiated, and we would like to encourage more. Similar encouragement from this inquiry can improve safety further. Before taking your questions, it may assist the committee if I provide some background on the ATSB's remit under the Transport Safety Investigation Act 2003 to understand the reasons for the safety action that we're encouraging. Firstly, we are completely independent. We're independent of regulators and we're independent of industry. Secondly, we take a no-blame approach to investigations and we focus on systemic safety factors, not on the one-off actions of individuals. We seek to understand what regulatory and organisational risk controls could have been in place to reduce the chance of future incidents and accidents. Modern accident investigation methodology is heavily influenced by Professor James Reason, who stated discovering an error is the beginning of the search for the cause, not the end. That means in this accident, the investigation looked beyond the fact that the pilot took off in poor weather without the qualifications and experience to do so, to look for contributing and other safety factors that increase the risk of the accident. We're seeking to prevent similar accidents in the future. The ATSB's methodology was recognised as best practice by the Canadian Transport Safety Board in its independent review of the ATSB in 2014. We consistently apply our approach using a team of investigators with an array of different backgrounds, multiple levels of review and scrutiny, a natural justice process with external parties, that includes AngelFlight and CASA in this case, and finally a commission approval process. This rigour ensures our investigation reports are fair, balanced and factually correct. This investigation also included data analysis using well-tested and validated techniques consistent with many years of research performed and published by the ATSB. Research scientists on staff are expert at aviation safety analysis. For transparency, all the details of the data used and all of the analyses have been outlined in the extensive appendices to this report. Our investigations also follow the Minister's Statement of Expectations for the ATSB by giving priority to transport safety investigations that have the potential to deliver the greatest public benefit. As such, a primary focus is risks to the travelling public involved in passenger transport. As the ATSB is not the regulator, we have no power to force organisations to take safety action. Instead, we rely on our influence, the influence of others, and the mature safety cultures of the organisations involved who are prepared to adopt a lessons learned approach to safety. This lessons learned approach from this investigation, well, the lessons learned are clear. By any measure, there is a different and elevated risk for community service flights operated by AngelFlight Australia compared to other private flying operations and commercial air transport. Similar risks were identified in the United States a decade ago, and independent statements from Australian community service flight pilots show that there's already this understanding in Australia as well. We have called for reasonable and achievable safety actions. AngelFlight's accepted and is currently developing processes to address the safety issue relating to the additional risks associated with community service flights. It has already addressed another safety issue concerning the future reporting of safety incidents, and the third safety issue resulted in the safety recommendation for AngelFlight to have processes in place to consider a commercial flight before organising a private flight. The ATSB wishes to see AngelFlight continue to provide its valuable service, organising flights enabling rural and regional Australians to meet medical appointments in major cities. To do so, the ATSB encourages AngelFlight to address the safety issues in the investigation report, to avoid future tragedies, and to ensure the best possible level of safety is afforded to the passengers benefiting from this community service. We welcome your questions, recognising that this committee may have questions relating to aviation safety, the measurement of aviation risk, data analyses or ATSB's legislation. I've brought along subject matter experts relevant to this inquiry. I'm the Chief Commissioner. I served almost 10 years as an Air Force officer in Australia and in the Middle East before undertaking various senior roles at Air Services Australia and CASA. I've been appearing in front of this committee since 2006.
You have.
I've been a glider pilot since the age of 15. I'm also a general aviation pilot and until recently owned my own aircraft. On my left at the end, Commissioner Manning. Chris Manning has had a flying career of nearly 50 years. His time as a pilot with Qantas culminated in his appointment as Qantas's chief pilot. Prior to his tenure as chief pilot, he also served as the president of the Pilots Union, the Australian and International Pilots Association. Executive Director Transport Safety Nat Nagy, on my far right, began a commercial flying career at the age of 18. Whilst flying was his first career, he proceeded on to a second career as an air traffic controller, then senior manager with Air Services Australia. Director Transport Safety, Dr. Stuart Godley, to my left, holds a PhD in Human Factors Psychology. Prior to joining the ATSB, Dr. Godley was the Manager Safety Analysis and Human Factors with Qantas. He has almost 20 years' experience in analysing aviation safety data. The ATSB's Manager Legal and Governance, to my right, is Pat Hornby, who holds a Law and Political Science degree and postgraduate legal qualifications. During his time at the ATSB, he has negotiated and drafted international instruments covering the standards for accident investigation. So we would welcome any of the questions that you or the committee might have. Chair.
Thank you very much, Mr Hood. We're going to start with Senator Brockman. Senator Brockman, would you like to commence your questions?
Thank you, Chair, and apologies for having to do this on the phone. It's always a bit difficult and a bit fraught, I know, and hopefully I won't drop out. And I guess the reason I'm on the phone is partly brings what we're discussing here today into a bit of relief. I'm in a little place called Newdigate in Western Australia, which if you look on your map is pretty much equidistant between four major population centres: Perth, Kalgoorlie, Esperance and Albany. If someone gets sick or has to go to a medical appointment from Newdigate, a non-urgent medical appointment from Newdigate, they face at least a 2.5-hour drive in any one of four directions. If they want to go to the city, it's more like a 4-hour drive. So in the bush in WA in particular, stuff does come into pretty stark relief. Firstly, I'd just like to ask the nexus between the statistics you have provided in your report and the other analysis. How do you utilise the statistics in the report in your final decision making?
Sorry, Senator, and thanks very much for the context of where you are. Can you just clarify the decision making portion of the question?
Well, in terms of the final recommendations from the report.
I'll ask Dr. Godley to talk about the findings, Senator, and how we arrived at those.
Okay. So does everyone have a copy of the report?
So we'll table a copy.
We'll table a copy. But
I noticed you've got one stapled together there. We can actually give you a nice bound one, Senator. Yeah. Sorry you haven't got one, Senator Brockman.
So the findings are on page 49.
We're lucky we have such a diligent secretariat that they provided us with a rundown on it anyway. Send the still version of the wrap-up.
So Dr. Godley's referring the committee to page 49.
So the statistics that we've been talking about really address the findings 4 and 5, so the first two under the other factors that increase risk. So the first one is community service flights conducted on behalf of AngelFlight had considerably more occurrences per flight than other private aviation operations. It is almost certain that this higher occurrence rate is due to exposure to different operational factors as a result of the task being undertaken. And then secondly is the safety issue, which follows on from that finding, which is that AngelFlight had insufficient controls in place and provided inadequate guidance to pilots to address the additional operational risks associated with community service flights. And we're pleased to see that AngelFlight have actually accepted that safety issue and as they pointed out, they've started a number of initiatives in several areas to improve both training, education and support to their pilots.
Dr. Godley, I think Senator Brockman was actually asking you to talk to the statistics, how they were generated, the
Okay.
considerably more occurrences per flight.
Yep, okay. So I've got a cold, so I might need to drink as I go through. So the investigation started off with the second fatal accident. That sort of drew our... that's all right, I got water. And that sort of drew our attention to it. to the fact that there might be something in this.
This is the Mount Gambier one.
This is the Mount Gambier accident following the 2011 accident near Neil in Victoria. And so when you did the statistics looking at passenger flights, the risk for fatal accident, we found it was 7 times more than other private operations, and we used other private operations because AngelFlight was being operated as a private operation. So it's the regulatory regime that it was being operated under. From there, that was just the start. So we didn't draw conclusions on that. But what we did was that then we did an extensive search on our database. So ATSB holds the Australian Aviation Occurrence Database. But unfortunately, because they were regulated as a private flight, and there was no indication about what was private and what was community service flight, we had to get the data of AngelFlight. So as been mentioned today, they gave us records of all of their flights. So they had, a bit over 20,000 flights. They had records for 13 years of that. We looked at the last 10 years for the analysis to be mostly fair and contemporaneous for AngelFlight, and our analysis is based on that. But I can give you data for the whole set if you want. And then from that, what we had to do is we had to take we had to take those flights and then identify in the database which ones were actually AngelFlight related. And so that obviously took many months of work. This has never been done before. This data has never been available to ATSB, CASA, AngelFlight, because the flights had never been identified. So after many months of work, we identified the data set and we could do our figures. Is that sort of answering the question, or do you want me to go on with the
Senator
statistics?
Brockman?
It is. I guess it's raised another question in my mind. You mentioned there that you use the contemporary data to be fair to AngelFlight, but my way of thinking, given you're only dealing with 2 fatal incidents, and obviously too many, but 2 fatal incidents over the last 7 years, is that correct?
Longer.
2011 to 2017.
Yeah, so that was a 10-year period, Senator, and so we did have the data. So AngelFlight's been operating since 2003. They had no flight records for the first 2 years of operation, but they've told us that they didn't do many flights in those first 2 years. So what we do have is we have data for 13 years. And if you look at the 2 fatal accidents over those 13 years, then you still get a fatal accident rate of 5.8 times higher than the rest of private aviation. So it's less than a 7, but it's still 5.8. It would have still led us to the analysis that we've done based on that.
Okay, my principal concern with using statistics in this way, and I do not pretend to be a statistician, I have a amateur's interest in it, but is that with 2 data points on one side of the equation, how are you getting to anything remotely approaching statistical significance?
Okay, Senator, so what we did was we had so we had 2 accidents, but what we did, we normalised it by flights. We had 2 accidents. We had a bit over 13,000 private flights conducted by AngelFlight, and we compared that to the rest of private aviation, where we had something like 72 odd fatal accidents and 3.5 million flights in that time. From that, you can compare a rate, and then we can apply statistics to that, and those statistics say that it's likely, or actually that it's very likely that difference, the 7 times higher, is not due to chance alone.
If I can, Senator.
Okay.
Sorry, Senator Brockman.
Sorry.
Greg Hood again. If I can, I think the ATSB, as Dr. Godley said, has had the ATSB Aviation Safety Occurrence Base in existence since 1969. We have periodically reviewed various sectors of the industry and compared them in terms of their relative levels of safety. So we've got the flying training, we have RAOs, we have aerial agriculture, we have sports rotorcraft. So we have a level of safety for those different sectors of the industry. What we didn't have, and in fact what AngelFlight didn't have, is they didn't have access to all the reported safety occurrences because they weren't required to be reported to AngelFlight. So AngelFlight didn't have any great knowledge of the number of safety occurrences being experienced on their missions. Neither did CASA and neither did the ATSB. So what we did is we had to request the data from AngelFlight to get the schedules. We then matched that with the flight plan data and the aviation safety data, and using an algorithm written, we're actually then able to extract the aviation safety occurrences that were being experienced with these types of flights. So what we've done in effect, we've never done before for the community service flight sector, and we've actually baselined the safety, and of course now we'll be able to measure it just like we do for any of the other sectors of industry for improvements.
So earlier we heard from AngelFlight that that it was not there was not a international standard for measuring incidents. Using flight hours or flights. So you've just used flights, and I think AngelFlight made an interesting point that, you know, a flight, a touch and go, a joy flight will obviously be much shorter than, for example, a regional flight. How did you make the decision to use flight numbers, not flight hours?
Sure, and while I asked Dr. Godley to answer, the ATSB's legislation, the Transport Safety Investigation Act, is drawn from the International Civil Aviation Organisation, Annex 13. So our processes, our methodologies, etc., are all drawn from the international standard. But in specific relation to the flights versus flight hours, I'll get Dr. Godley to talk to that.
Thanks, Senator. Yeah, I've got a number of points to that. So we'll just start with, if you do the analysis by hours, and they are in the appendix as well, in Appendix B, page 67, you can see that if you have a look at, say, fatal accidents on passenger flights, instead of being 7 times higher, it's 5.6 times higher. If you look at all occurrences, which is what we based our findings on, instead of being 4 times higher, they were 3.7 times higher. So the numbers are very, very similar. We would have
using pre-positioning flights.
No, but we
because that seems to be fundamentally flawed.
Yep,
in
so
what,
we can do that as well,
doing.
Senator. So pre-positioning flights are.
If you include the pre-positioning flights, what are the numbers then?
Okay, so they are in the report. So if
Well,
you look at
what
are they?
Okay, so if you look at, say, all occurrences, passenger flights alone, we see a 4 times higher risk. If you look at the pre-positioning flights alone, we see a double of
together,
the risk. Together, we see a 3.2 times the risk, rather than the risk that we talked about, which was 4 times the risk. So it's very, very similar, but the fact that there is a difference, so a doubling of the risk when there's passengers on board compared to when there's passengers not on board, suggests that there are actually operational differences when there's passengers on board as well.
Can I just jump back in there? Again, getting back to my original point, which is the low sample size on one side of the equation. I mean, in one category, the accident category, the private flights were actually more risky than AngelFlights, on an 82.2% probability that the private accident rate was higher than AngelFlight accident rate. Now, I would assume that you would put that to one side and say it's a statistical anomaly based on a small number of data points.
I'm not sure when you're getting that figure from, Senator, but I don't think that's correct. So the 82% probability refers to fatal accident flights, and it refers to when we combine both the repositioning flights and the passenger flights.
Yeah, but in your breakdown, I think I don't have it in front of me. I think it was on page 69.
Bottom of page 69.
Sorry?
Yeah, the bottom of 69, Senator.
So the table in page 69.
Yeah, there is a category of accidents.
Yes.
In which there's 17.8% probability that AngelFlight was actually safer than that AngelFlight versus the private accident rate, 17.8% probability that AngelFlight was more accident prone. That being the case, it actually means that 82.2% probability that private flight accident rate was higher than AngelFlight in that category.
So that
I'm not arguing about that. What I'm saying is that presumably you would put that to one side in your report because of low number of data points. My concern is the overall analysis being based on one side of the equation on such a low number of data points makes the statistical significance extraordinarily low. I mean, you're looking at a rate in terms of the fatal accident category of a probability of 82%. Now, statistical significance would normally want to be in the category of 95 to 99% to be considered statistically significant.
Can I go? So Senator, we actually based all of our conclusions on analysis of all occurrences. So these are incidents and accidents combined. That's the most reliable set. It's the most widespread, as in it's the data set with the most numbers. And you'll see in that table that all of those, whether we combine just the passenger flights by themselves or we combine the passenger flights with the repositioning flights, they're all at that 99% or higher statistical level. And as a result, the findings in our report talk about being almost certain that these are due to differences in the operational the operational characteristics of AngelFlight compared to other private flights.
But you would agree that the raw statement in your report that fatal accident rate was more than 7 times higher per flight than other private flights does not meet that level of statistical significance.
So that met a level of 96.8%, and we didn't call it statistically significant. We called it very likely, and that is consistent with the way that ATSB does our analysis. We've done it that way for many decades, at least 15 years, if not longer, and that's pretty consistent with the way safety agencies do analysis across the world.
So explain to me the difference between that 96% you just mentioned and the 82%, which is in that table on page 69, comparing fatal accident rate, AF versus PV.
So one is fatal accident rates, and again we concentrated on passenger carrying flights because that's essentially the risk that we're most interested in reducing, and that's what the 96.8% dealt with the fatal accident rate for private passenger flights. I think what you're referring to is if you combine all the flights together, you're looking at the positioning flights and the passenger flights together. You're looking at everything that's caused an accident. That might be a gear up landing. It might be anything that causes some sort of damage to the aircraft. They're normally a bit more minor, and there weren't very many in the data set either.
Does it include information where, say, air traffic control made a mistake or some other pilot in another aircraft made a mistake?
So not what Senator Brockman is talking about.
Sure.
He's talking about accidents, so they're really the wheels up landing type scenarios. But the analysis of the...
I thought you said incidents as well.
Yep, so what we based our conclusions on were all incidents. So if you turn to page 33, you'll see the breakdown of the type of incidents that we found where AngelFlight had more of than other private operations once it was normalised. These are all operational type incidents. You'll notice a lot of them involved controlled airspace, as you said, Senator. And one of the comments before was that, well, AngelFlight's operate into controlled airspace more than other private aviation. And that probably accounts for some of the data, but that's actually what we're looking for. We're looking at are there additional risks beyond that private regulatory regime that they're regulated under, that AngelFlight pilots are exposed to. And one of the key things that came out were runway events, operational non-compliance with air traffic control communications, and those sort of things to do with controlled airspace. You'll notice the fourth one in the bar there is what's called ANSP errors, so air traffic control errors. They're the sort of errors that, you know, it's not something that the pilot's done, it's something air traffic control's done. So these are obviously in both data sets, the private data set and the AngelFlight data set. But you'll see that the difference there is very much smaller compared to the events that are actually down to pilot actions, the runway events, the operational non-compliances, suggesting that there's an additional level of complexity there.
So am I correct in saying that if you compare AngelFlight with passengers to all private flights, you get the 7 times higher. But if you compare AngelFlight combined with all passengers or all private flights combined, then the fatality rate is 2.5 times higher?
And then the fatality rate is 2.5 times higher.
Okay. And at an 82% probability that there is a genuine difference.
Correct, yes.
Okay. So again, this will be my last question, Chair, and I won't stay on the line because it's not the best for everybody. But again, we've only got 2 data points over 10 years. How is it possible to make accurate statistical inferences from 2 data points over 10 years?
So it's really just a repeat of the 96.8% means that the statistics show that wouldn't happen by chance alone. So if to put it another way, if you look at the number of flights that AngelFlight have done, and then if they had a fatal accident rate at the same level of the rest of private aviation, you'd be looking at 1 accident every 37 years.
Every 37 what?
Every 37 years. So obviously we've seen 2 accidents, one in 2011, one in 2017, quite close together. That suggests that there's something different about AngelFlight operations to the rest of private aviation.
So, hang on, sorry. Are you saying that there's only 1 accident every 37 years in general aviation?
No, so general aviation obviously is very, very, and actually I'm not talking about general aviation, I'm talking about private flights.
Yep.
So private flying is very, very large. They have 3.5 million flights over the last decade. If AngelFlight had done, if you scale that to the number of flights that AngelFlight have done, you'd expect 1 fatal accident every 37 years.
But there's been accidents in general aviation a lot more than
but
every 37 years.
Yeah, so to put it in perspective, Senator, so AngelFlight are doing a bit over 13,000 private flights in the last decade. There's 3.5 million other private aviation. So it's a bit hard to compare it on numbers. But we're just comparing it to the rates.
But again, that's my point. If you took either one of those accidents out of the equation, you would actually find that AngelFlight was safer
Senator
than other private flights. And
look outside, you got the words up.
On that basis, I just think I'm having difficulty with the level of certainty you're putting on this.
Senator Patrick Hornby, Manager of Legal and Governance. I'll throw back to Mr Godley, but Mr Godley took you first to the page that's got our findings on it. It was an important reference point to start with because our findings around the safety issue there is on all occurrences, so it is accidents and incidents, so it's not just on those 2 fatal accidents. So I think that's very important when the original question was around, well, how do you get to your findings? So there's a lot larger data set there to work from. So I'll pass back to Mr Godley.
Yeah, and that's, I would have said that, but it's the fatal accidents was the starting point. It wasn't how we got to the conclusions.
All right. Thank you, Chair. I'll leave it there.
Thank you, Senator Brockman. Senator Patrick.
Thank you, Chair. So 2 accidents in 20 years doesn't really seem like systematic issues that the ATSB are charged to look at.
So I'll just take you back, Senator, to the last Senate inquiry for the ATSB, where this committee found that the ATSB concentrated its efforts too much on looking at the individual contribution to an accident, not on organisational and systemic factors. What we have here is 2 fatal
I'm going to stop you there, because the Pell Air flight that you're talking about, the ATSB were found negligent by the committee, and then obviously it led to the whole report being done again, was because you focused on the pilot instead of all of the other areas of aviation involved with that accident. It wasn't to do with Pell Air's operations over many years. So
I thought that's what I said.
No, you were suggesting that the committee had steered you to look at something from a systematic level, like you've done with AngelFlight. The committee at that point in time said, no, you need to look at this accident and look at why, for example, Auckland Control didn't provide weather information to the pilot. That's what the committee said. It did not say to go and look at Pell Air systematically over many years.
So this is what we're trying to do in this particular case, Senator, is look systemically at these
please don't suggest that the Senate committee steered you down that path.
So
they did not.
If that was interpretation, I apologise. It certainly wasn't my intent.
Sorry. Okay, so actually I want to go back to an answer you provided me on notice and estimates, but it relates to this inquiry. I said, I'm being really specific, I'd like you to have an answer on this. Have you talked to a number of AngelFlight pilots? If so, how many, in respect of pressures that might be put on them in relation to community service flights? You said, we have talked to AngelFlight pilots. I'd have to take that on notice. And the answer you gave me is one of the most unsatisfactory answers that has ever been presented to this committee, in my view. You said, over the course of the investigation, the ATS has interviewed a number of pilots with varying backgrounds. ATSB can provide a number after the completion of its investigation. I was specifically after the number of pilots you'd talked to, because at that point in time you had prepared a draft report, and it's highly relevant to the conduct of your organisation as to how you've done consultation. So that question was not answered. I want to know how many pilots you had spoken to on the up to the date of the 8th of April 2019.
Senator, so I certainly apologise. I wasn't meaning to be evasive or anything.
There is no way that answer could ever be, that the answer that was provided to the committee could ever be considered by anyone to be sufficient in terms of openness and transparency of the ATSB as is required before this committee.
So my apologies. I think, Senator, that the investigation wasn't complete and we were not yet certain of how many people that we would have spoken to.
No, well, the investigation wasn't complete, but surely you would know how many people you've spoken to. Surely your records up to that date would have said you'd gone out and talked to this many people. How many people did you talk to from AngelFlight pilots throughout this investigation?
So I'll get Dr. Godley or Mr. Hornby to talk about how we went about understanding the best methodology to apply in this particular case. It's very important from our perspective that all our investigations are supported by evidence. We did consider whether we should poll 3,000 AngelFlight pilots to get the full cross-section of opinions. We felt that could inject a fair bit of subjectivity. What we did have was submissions from AngelFlight pilots to the CASA notification of proposed rulemaking, all of which, or many of which, indicated that there were pressures and challenges faced by AngelFlight pilots. And in fact, I think Dr. Creese today said there were pressures and challenges facing AngelFlight pilots. So in this particular case, the methodology we chose to use...
In some sense, it's a key requirement, it's a key finding of the report. So how many pilots did you speak to? If pressure was an issue...
Dr. Golding?
Yep, thank you, Senator. So we've outlined this in the report. So we didn't speak to any pilots about whether they've experienced perceived pressure, And that's because we were very confident in the argument. So we had submissions to the 2014 CASA instruments where people are showing that some people are showing that they have perceived pressure. We have evidence from the US where NTSB, the equivalent of us, investigations have found the
pressure
same.
generally
Can I
relates to
finish?
culture
Can I finish,
of an
please?
organisation.
Can I? Is it okay if
So
I
I
finish?
think specifically, Senator Patrick was asking how many pilots,
Yeah,
AngelFlight
it's a
pilots,
number.
you
Okay.
investigated in relation to this report.
Yep. So
This period.
my answer in terms of whether people perceived pressure, we didn't ask that question, and the reasons why are outlined on page 26, and the reasons why is because we were very confident that some pilots, some of the time, do experience pressures, and it doesn't matter whether that's 5% or 90%. That the risk is still out there, and that's the sort of risk that we think should be addressed.
Mr. Godley, how many Angel flights that have occurred have cancelled during an operation?
So there are some, but of course that's and you'll see this from the submissions and plenty of other commentary around. AngelFlight has a range of pilots, people from with the Bear to 250.
Answer my question that I'm asking you. How many have you conducted any analysis on how many pilots, they're engaged in an operation?
I think we have, but I don't have that figure with me. And
Can you come back and look at that on us? So I would have thought you're looking at pressure points, you're looking at cultures of organisations, yet you haven't talked to a pilot and you're unable to tell what I would consider to be a pretty obvious thing to do, which is to go and say, well, there's pressure for people to complete these flights. How many pilots counsel? We know that Mr. Owen did.
Yep.
He told us so.
So I'm happy for me to respond. So
Yeah, actually we are.
So if we go back to what I said earlier, we're very confident that some pilots, some of the time, feel pressures. As it's in a report, not all pilots will feel pressure. Not all pilots will feel pressure in the same situations. Some pilots may not feel that pressure because they haven't been exposed to those situations. But as what's very evident, and we've got some quotes in the report on page 25, examples of these sort of pressures. It's
from AngelFlight pilots.
From AngelFlight pilots. It's the sort of pressure that you're carrying people that are often unknown to you. They're relying on you. They're sick. You've got to meet a scheduled deadline to bring them to a medical appointment. You've got to travel to a big city. All these things are potential pressures that may affect some people sometime, and then they definitely do affect some AngelFlight pilots some of the time.
25.
And it doesn't really matter if it affects all 3,000 or actually only 50, because that's out there, and that's potential leading to an accident, and that's the sort of that's the sort of issue that we just think AngelFlight can address, and they have already started addressing that. So they actually agree that there's an issue there.
So I just want to be very clear on this. So you have taken responses from respondents who didn't know they weren't answering a specific question on this, who didn't know that their answers would be used to go towards this sort of report, and you've extracted those and extrapolated them into your report, which talks about, attributes the high rate of accident rate, particularly pilots experiencing perceived or self-injured pressures. So it seems to me to be a fairly significant leap to take answers from respondents who weren't aware they were asked this question, not a specific question, and not in relation directly to this accident, but yet you have used it in relation directly to this accident.
So I actually think it's the opposite. So these people weren't being asked whether they had pressure, that they volunteered this information.
Okay.
So we've taken that information. It was in the earlier 2014 report. If you look at the research in the US, after the NTSB investigation of 4 similar accidents, the US AOPA, and we've had our AOPA rep here today, have taken on board to actually put education and training program in place for AngelFlight pilots in the US, specifically dealing with perceived pressure, because they recognise that it's a...
Chair, sorry, I don't want to cut on too much of Senator Patrick, But Dr. Godley, in here it says at least, the 18 responses, at least 12 were pilots. But how many of these pilots were AngelFlight pilots? Sorry, not that I don't believe it, but that doesn't mean anything to me.
So at least, when it says at least 12, that means we know 12 were, but
12 were AngelFlight pilots?
But there could have been more community service flight pilots.
Dr. Golly,
yes.
Were 12 pilots AngelFlight pilots?
Yes.
And they said that they felt pressure? They've said it to CASA, not to you?
Yeah, yes. And that was in a public submission that involved non-pilots as well as pilots.
So you did talk to Care Flight pilots?
No, this was to CASA, yeah.
So noting my question, over the course of the investigation, back on the 8th of April, the answer to the question is 0, based on your evidence.
Just trying to go back to the basics.
Correct.
I want to know if
Those
to do with perceived pressures, yes.
Okay, so we don't have to take that on notice now. We know the answer was 0, and we got to the end of the entire investigation without talking to any AngelFlight pilots about pressure. Can I just want to go back to the statistics, because I'm reading this to say that if you include the pre-positioning flights, per 10,000 flights, in terms of accidents, AngelFlight comes up at 1.5, and you've got the other flights coming up at much higher numbers.
Sorry, could you
You've got
say
a
that
1.5. Just looking at on page 69, if you include the pre-positioning flights and post-positioning flights.
So you're just talking about the subset of accidents.
Yeah, yeah.
Yep, and that was Senator Brockman's point. Yes.
Yeah. Okay. So when you chose to was it a discretionary choice or some choice you made in respect of not including pre-positioned flights, or is there some standard by which that is the requirement for these investigations?
Well, if you look at the current definition of a community service flight, that
No.
it's about passengers.
Okay, well, that definition actually came out after this accident, 2 years after this action occurred.
Yes, but it is
and
consistent
it's semantics. The reality is the flight starts, the pressure starts from the moment they first get out onto to the tarmac.
Yep.
At their original location. They know they need to get to wherever they need to get to pick up the passenger. Probably the last sector has less pressure on it. It just seems totally against all reasonableness to cut out those flights. I'm just wondering,
as we said, we didn't
in
cut
terms
out
of
those
international standards. Are there any international standards that suggest the way you are doing it is the way that it should be done?
I don't know. There is no international standard, but as I said before, even we made our conclusions based on all incidents, and when you look at pre-positioning flights as well as passenger flights, it's still higher for all those together, but there is a difference between pre-positioning flights and passenger flights, so the risk is not the same. The risk is slightly higher. It is higher when there's passengers on board.
Okay, Mr. Hood, just changing tacks, if you indulge me, Chair. One of the recommendations that flows from this report is that we now get AngelFlight to conduct, or to, instead of using their pilots, to use commercial flights. Now, of course, you have no power to make them do that, and in fact, I don't think CASA would have a power to make them do that. So, in essence, you're going to someone who, to put it in simple terms, who grows apples and saying, I want you to do oranges. These guys do these particular flights, so there's no requirement for them to do this. So in terms of thinking through this recommendation, what you're suggesting is that commercial flights need to, should be a choice of these passengers. Now, they clearly can't afford to do that. So who is going to pay for these commercial flights? Is that going to come from the ATSB budget? Have you talked to anyone in government about how you might pay for these flights?
So, Senator, thanks for the question. We did look around the world too. There's a similar demographic in Canada. Their community service flight organisation is called AOPA. 70% of the people carried on AOPA are carried on commercial flights.
Yeah, go back to my question. Okay, I'm talking about the current regime we have here in Australia. You can dream up whatever you like, but if you can't legislate for them to do that, that would have to be a choice they make. that means someone is going to have to bear the cost of that commercial flight. Who do you say is going to do that?
Sorry, Senator, maybe I was trying to answer it in a roundabout
Sure.
way.
No, I like direct answers,
but
actually.
the Hope Air charity
Yeah.
in Canada funds the travel on the commercial flight.
Yeah. So that they don't operate here. So who in Australia is going to fund it?
If I can be permitted to finish, they also have airline partnership scheme. They also have GA pilots, recognising the fact that the demographic is almost identical to Australia. About 70% of those locations in Canada are serviced by commercial flights. 69% in Australia are serviced by commercial flights. 31% are locations, I think, like Senator Holly Hughes said when she was in Barwara, whatever the name is in Queensland, you know, she utilised the service regularly for her child because there were no commercial flights. So fully accept that. But what we said is, given the delta in the safety between the private flights and the AngelFlight flights, we recommended that the charity consider looking at commercial flights, and I would have thought that you know, in terms of the raising funds for that they would fund the carriage on commercial flights.
But can I add to that, Senator? So the report actually does a bit of a cost analysis, and it shows that once you take into account the cost of the reimbursement of fuel to pilots, which happens on 85 to 90% of flights, compare that to the price of 2 passengers on an airline flight, and then even taking into account passenger needs, so that obviously there's going to be some passengers that they can't use a commercial flight for a variety of reasons. When you take all of that into account, there's probably about a third, or at least a third, of the flights that have been done by AngelFlight that could have been done on an airline at no additional cost to AngelFlight to buy those tickets at a commercial rate compared to reimbursing the fuels.
But their model is the way they've set themselves up, and you know, clearly they've got volunteer pilots. They want to go down a particular pathway. In the absence of them agreeing to do that, do you say that recommendation therefore doesn't stand? I mean, so I understand the point you're making. You're saying we're putting that out there as an idea,
and what we're really careful to show is that the main aim here is to move people that don't have the financial means themselves from a country area to a medical facility. Okay, and if AngelFlight want to do that the safest possible way, all we're saying is that why don't you consider, is there a commercial flight available? Is the passenger, you know, does the passenger needs mean that they can fly on a commercial flight? And if so, why don't you book a commercial flight before you book a private flight? That's really the essence of the recommendation, and that's it.
Okay. You realise that if AngelFlight were not there, most people would then have to go to road transport. Are you aware of the statistics of road accidents in South Australia?
We are aware of the statistics. We're not an agency that investigates road accidents, and we don't maintain the database, but we're certainly aware of the road statistics, and particularly country roads.
But in terms of your responsibility to the public, noting the importance of these flights, and I don't think there's anyone that disagrees about the importance of these flights, one of the alternatives that would, the most likely alternative for people who couldn't afford to do this, couldn't afford the commercial flights, because would in fact be to revert to road, where the accident rate is much higher.
So
I think 39 accidents in the Limestone Coast. I think I'll check that.
Yeah, but again, you'd have to normalise that by the kilometres travelled or time or something. But really, there's nothing in our report that's going to stop AngelFlight operating. The only safety issues in our report that can be addressed are going to increase the safety. So there's no reason why anything in our report will push people out of aeroplanes onto the road.
But if we look at pressure as being the cause of or a contributor to the accident or the
so we actually haven't said that, Senator.
Okay.
So the perceived pressure is another factor, because we don't have evidence around what the pilot was thinking, or we don't have recorders on board, etc. And we're talking about perceived pressure. So the pilot might not even notice.
So where are the recommendations, detailed recommendations of what CASA should be doing in relation to pilots and perceived pressures on any flights?
So where the recommendations come, and it's not a recommendation, it's a safety issue. which AngelFlight have already started to take action, is to do with the perceived pressure that AngelFlight pilots will have from time to time. And because it's to do with AngelFlight pilots, the safety issue is addressed at AngelFlight. And AngelFlight, to their credit, they've taken it on board and they've started a lot of action.
Respectfully, AngelFlight pilots use CASA trained and licensed pilots.
Yep,
the training for these pilots or the responsibility for ensuring people are safe to fly rests with CASA.
And really that was really the essence behind the data analysis. So the data analysis shows that there are additional operational risks that AngelFlight
Respectfully,
pilots,
I think you've taken the wrong numbers, and it suits. I get it. It suits your
It doesn't
your
matter
answer.
which way you cut the pie, Senator. It's AngelFlight is still higher, and so it shows that they're exposed to additional operational risks to the normal private pilot, and AngelFlight are actually in the best position to do that. And if they don't do it, well then perhaps CASA has to do it. But then CASA
Okay,
will
let's go to
obviously have
CASA's
regulate.
response.
Senator Patrick, would you mind if
Yep,
I
no,
just...
that's fine.
Yes,
Yeah, go for
I think your point is well made, and we will be talking to CASA next about their training.
Thank you, Chair.
Senator Rennick, do you have a
okay.
question there?
So, Dr. Godley, you've said there's nothing in your report that's going to stop AngelFlight from continuing. Can you summarise briefly what changes you want AngelFlight to make and how it will impact AngelFlight?
Okay, so there's really only there's three areas. The first one is the easiest. So at the time of the accident, AngelFlight was unaware of any incidents occurring by its pilots. So they were aware of about 10% of the occurrences that we found in our database when we did the analysis. So now they require their pilots to report all incidents to them. So they've already dealt with that safety issue,
Yep.
and they've got Dr. Owen over there as their new safety manager to deal with that.
Yep.
The second one is a safety issue to do with they had inadequate controls and provided inadequate guidance to their pilots to deal with the additional risks. They've started to do safety action on that.
So when you say, sorry for interrupting you, additional risk, is that because the patient is ill?
Yep. So if you
even if I'll just lead on my question there. So if the patient's ill, isn't the risk going to be the same on a commercial flight as it would be on an Angel flight?
No, it's more about so the safety analysis on page 43 outlines it. So we've got those dot points. The key differences between an AngelFlight and other private operations is the carriage of ill, unrelated, and often unknown passengers rather than your family and friends, and the fact that you're flying to meet a schedule rather than choosing when you fly, which is what most private.
But all
flights
those
do.
risks you can't really move. If the patient is ill, the patient's ill. So the risk is with the flight, but the fact that the patient's sick, isn't it?
So it's more to do with the fact that what sort of impact does that have on the pilot's decision making? So, and when we're talking about perceived pressures, the pilots won't necessarily know that they're perceiving the pressure, and maybe, as in the case in this accident, it was unsuitable to fly in, but that pilot's chosen to fly in it anyway, and possibly that was because there was this pressure.
But,
I've got to get these people
going
to
back
their
to
medical
Senator
appointments.
Patrick's comment, then if he doesn't fly and he's in the car, then possibly the driver of the car is going to take similar risks as well, knowing that the patient is ill. I guess my point is the risk stems from the fact that the patient is ill and not from the flight itself. And therefore, you're always going to have that risk there. You can't really remove that. The flight isn't the issue, it's the fact that the patient is ill.
I think
and needs to get to hospital quickly or something like that, or
if you go back to there's very clear rules about what you can and can't fly in when you're a visual pilot.
Right.
And in this case and in the other accident, the pilot broke those rules, and they broke those rules because of the pressures probably that were on them on the day. They didn't break the rules because they were wanting to be reckless. Most likely, it was probably due to these other pressures. So these are the sort of the controls to do with this are things like training and education, specifically about identifying when you're affected by those pressures, and then what to do about them, and having the support in place. So whether it's an app, whether it's a mentor pilot, whether it's a pilot that you can ring up, all those sort of tools that we take for granted
So-
in public,
okay.
in commercial aviation.
Sure.
Pilot?
I'm not, no.
No. Okay, and then
I
what's
work
your
for an
third?
airline,
So
though.
what's the third change? Because I mean, while I accept that there's extra pressure there, I still think a lot of that's to do with the illness of the patient, and that will always be there. And then, so what's the third impact?
And the third one is taking into account that, so private aviation, leaving aside AngelFlight, private aviation has a much riskier record than commercial aviation, and so if AngelFlight were taking into account the safety of their passengers over the long term, we're just asking them to consider booking a commercial flight if they're available, if they're suitable to the passengers, if they're cost comparative, if all those things are in place, and they were for this case. So in this case, there was 2 flights going from Mount Gambier to Adelaide that day. The passengers had no special needs. They could have been on those commercial flights. They had a fortnightly reoccurring medical appointment. So it's cases like that AngelFlight.
So you say they could have been, but it would have come at a cost, wouldn't it?
Yeah, but and it would have come at a very similar cost, if not cheaper, to AngelFlight booking the 2 people on that Rex flight than the reimbursement cost for the fuel to the pilot, and that's all in the report, the figures.
All right,
Okay.
last question.
Thank you.
Thank you, Chair. Mr. Hood, Ms. Pajani said that she had a call, or she believes a call took place when she'd spoken to CASA, that a day after the accident that the ATSB had called CASA and said, "What are you doing about this?" Are you aware of anyone in the ATSB?
I'll have to take that one on notice because I'm not aware of that.
Sorry?
I'm not aware of that.
Yeah, okay, so it wasn't you, wasn't anyone else at the table?
Not that I'm aware of. So.
If you could find that out, please, I'd be grateful.
Further to that, there was also a comment that when AngelFlight had contacted ATSB about, is this our flight, ATSB was told, we can't tell you, but then did make a public statement on the TV saying, we are investigating AngelFlight.
I'm
Can you
happy
comment
to take
on
that on
that?
notice too, and I'm not aware of the specific sequence of events.
But I can tell you that so the accident happened on the 28th in the morning. That night, Channel 9 was broadcasting to Australia that it was an AngelFlight mission. The next day at 2 p.m. was when we did our investigators didn't arrive to site the next day, and it was during that investigation, during that media briefing that I think we mentioned that it was an AngelFlight.
And somebody from ATSB had contacted AngelFlight during that period to confirm that it was their aircraft?
So we, I believe we were in contact, but we'll probably have to take that on notice.
If you could take that on
to find
notice,
the details,
that would
yeah.
be a good thing. Mr. Hood, you just mentioned that you're completely independent. Who does ATSB report to?
To the Parliament, the Minister with the portfolio responsibilities, Deputy Prime Minister, who's the Transport Minister.
Yeah, so you would take policy instructions or guidance from him?
That's correct, Senator.
Okay.
So, Patrick Hornby, just to follow up, we do get a statement of expectations from the Minister. Mr. Godley referred to that in one of his answers about the focus on the public benefit, and that then leads to our focus on the travelling public as part of that public benefit. The Minister can't direct us as to how to do an investigation, so that's where our independence comes from our legislation.
Right. I was impressed to hear the experience of the panel. Even Dr. Godley has worked for an airline. Do you think there's a culture at ATSB of thinking that commercial pilots are superior to general aviation pilots?
Senator, as a pilot myself and a pilot that's made mistakes, we see this all the time, and unfortunately what we see at the ATSB is the aftermath of when things don't go quite right or decisions have been made badly. So
no, I appreciate that, but when all your experience in the Air Force or in commercial airlines, do you think they're superior pilots?
I think they're superior pilots.
I think to put it in perspective as well, Senator, I'd say we would have more investigators from a general aviation background than we would from a airline background.
Okay. No, I was just trying to get to what the view is of the management of ATSB, if there was a...
Can I answer that? You can.
Right here.
Captain Manning.
Look, I know a lot of pilots. The answer is no. There are very good pilots in all spheres of aviation. There are some average ones, and there are some below average ones in all spheres. Obviously, airline pilots are trained continually. The training is continual, so you expect them to get to a higher standard. But whether they're innately better, really, I think that's fallacious, because they're probably not. You could take an AngelFlight pilots. There are some very, very good ones. I know a lot of them. You know, airline pilot type people who do it on the side. And like all spheres of aviation, there are the ones down the bottom. That's what happens. So the ATSB, I think we might only have one or two airline pilot type investigators. The rest are general aviation pilots. And I haven't seen that they think, you know, there are certainly more investigations into the heavy end of town, carry more passengers, more flights, more incidents. But no, I don't see that.
Thank you. Thank you for your time.
Senator, I just might, if I may, just one last thing, table a document, if that's all right with the committee. It's another brochure that we released after this accident, not specific to this accident, but accidents involving visual flight rules pilots in instrument meteorological conditions. So it picks up for private pilots more generally some of the risks that they face, and it's part of an educational program that we have, which is don't push it, don't go.
Was that mailed to every pilot? How would have they received it?
It would have gone out through our social media channels and contact networks.
We don't have access to pilots' email address. That's a regulatory. That's a CASA thing.
Put that out?
No, it's us.
No.
Distributing
it.
I would have to leave that as a question for CASA, but I mean, it's something that we produced rather than CASA, and we did push it out through our social media.
I understand that, but the question was, how did you get it out? And you don't have access to it. So I asked a very simple question. Did CASA assist? If you just yes or no, if you don't know, you don't try to flick it and then start diverting about we did it all. It's getting too late in the day.
All right, thank
I'll
you.
table the document if that's okay. Senator.
Thank you, Senator.
Just one copy.
You're obviously not a medical doctor, Dr. Godley. I didn't think so, because you frightened the crap out of Mr. Manning there while you kept coughing at him. Where you were there? I didn't know he was. Oh, look at Dr. Alec. Have a look at him. He's just champing at the bit to get up here and baffle us with his brilliance. The legal team. He does this to us in Senator Smith. He's like the Phantom. You don't hear him enter the room or leave. It's you lawyers. You're all the same, Tim.
Are you coming forward?
Come on.
We don't bite.
We got all day.
No.
Well, I don't bite. I'm looking at the chair. Biting earlier on. Collision with terrain. What do you mean that? Shouldn't read. I was reading about this plane crash on the plane yesterday. I only got halfway through there to put it down.
Shouldn't do that.
Not me old mate. Poor old Barry.
I welcome representatives of the Civil Aviation Safety Authority. For the Hansard record, could you please give your name and the capacity in which you appear today?
Chris Monahan, Executive Manager of National Operations and Standards.
Graham Crawford, Acting CEO and DAS of CASA.
Jonathan Alec, Executive Manager, Legal and Regulatory Affairs.
Thank you. And I invite you to make a brief opening statement before the committee asks questions. Do you wish to make an opening statement?
Yes, I would, Senator. Thank you very much. I'd like to first begin by passing on apologies on behalf of Shane Carmody, who could not be here today, so I'm afraid you're stuck with me.
That's all right.
Sorry?
We're happy.
Okay. I will try to be brief, but I would like to cover 5 key points in relation to CASA's aviation safety responsibilities in relation to the tragic Mount Gambier fatal accident on the 28th of June 2017, which resulted in the death of the pilot and the 2 passengers on board. First of all, Mr. Carmody is on record earlier this year saying that the changes introduced through CASA in March 29 instrument in relation to community service flights were not an attempt to close down the valued services that CSF organisations offer to rural and regional communities of Australia. On the contrary, we are trying to fulfil our mandate and the public's expectations by ensuring these flights continue to be conducted without placing passengers at unnecessary risk. Our position on this has not changed. 2. CASA believes the minimum standards introduced in March 2019 are very modest and are designed to ensure that CSF pilots have an increased level of experience and an appropriate level of currency sufficient to meet the more challenging factors inherent in conducting CSFs. We believe we have struck a rational balance between the need to mitigate the increased risks present in such flights, together with the important benefits these flights provide to the Australian community. We cannot fulfil our mandate by only focusing retrospectively on past accidents. We must also consider a range of factors and risk mitigators, including industry feedback, on any proposal changes received through consultation. In the case of CSF, we consider these factors in the context of 2 fatal accidents that resulted in the death of 6 individuals, the major causes of accidents in private operations being CFIT, controlled flight into terrain, landing incidents, pilot error, decision making, and power plant or engine related problems. Our regulatory responsibilities, the potential impact on the volunteer pilots, potential impacts on CSF operations, approaches taken by other international regulators towards similar operations. 3. CASA independently analysed available accident statistics. This analysis compared the community service flight sector to the general private flying sector over a 10-year period. The CASA analysis determined that the fatal accident rate was 5.4 times higher for CSF flights than for ordinary private flights.
Accident or incident?
Accident rates. When we did our analysis, we didn't have the visibility of incidents. 4. CASA provided the aviation community the opportunity to provide feedback on the proposed instrument during a 6-week consultation period. We considered 223 written responses from individuals and organisations, of which 217 identified to be pilots, including 115 who had flown CSF operations. The output from the consultation showed that as many respondents felt improvements were needed in the CSF space as those who felt little or no improvements were needed. CASA used all these inputs to improve, refine, craft the instrument in order to garner safety improvements with the least impact on those support CSF operations. And I note earlier from today that AngelFlight confirmed today that the CASA instrument had not been detrimental to AngelFlight or its services. In summary, the instrument demonstrates a risk-based proportionate approach to the identified risks with the aim of ensuring the safety of passengers carried on CSF flights. Thank you, Senator MacDonald. We're happy to take questions.
Thank you. Senator Patrick, can I
Yes.
assume you're going to start?
Oh, yep. Thank you, Chair. There's a parallel activity that's been taking place here. One of them is that the ATSB has been carrying out an investigation. Clearly, CASA has been doing something else in response to presumably the 2011 flight and then the 2017 flight. which ultimately, which clearly involved analysis, data analysis, which was different to what ATSB has done, and indeed then led to an instrument which was tabled in the Parliament. Can you just take me through the sort of steps you went through there, and why, and this is not a criticism, but just trying to get an understanding why you've done those actions, indeed before the ATSB reported, and indeed what interaction took place between the ATSB and CASA in respect of the consideration for the instrument being tabled.
Certainly, Senator. First of all, after the second fatal accident, that got our attention, and hence the reason why we did some analysis. We felt that the second accident provided us with some information to suggest that we should take some action, and that we should take action and not wait for the ATSB process to take its normal duration or incubation.
Is that normal?
Yes, that's normal for us, because if we believe there's a safety risk to be addressed, or we should implement a mitigation, we will not wait for the ATSB report. We will consciously evaluate the situation, do our own analysis, and determine what we do. So for us, we really apply a careful consideration. We're very conscious if we're going to make changes that impact a sector or a part of the flying community, that we will consult on that, and that's what we believe we did.
Okay. In respect of the instrument itself, and I have had the discussions with Mr. Carmody in relation to this, and I want to keep this short, so I'm just trying to work out a way we can do this without me going through every element of the instrument, which I have here before me. And I understand you might be attempting to impose a standard on community service flights, and I don't have an objection to that. There might be a couple of elements I want to talk to you about. But would you agree, rather than having us to go through all of this, that all of the things in the instrument, all of the provisions in the instrument, if they had been in place in 2011, would not have prevented these accidents?
Well, if you take the first accident in 2011, I believe
night VFR.
It was night VFR.
Yeah, okay.
The instrument addresses that.
Yep. Okay.
So if we had introduced that instrument, say, following that accident, or prior to that accident, we may have avoided it.
Okay. Thank you.
It relies, obviously, it still relies on pilot decision making.
Sure.
In reality, though, when we see two fatal accidents, and whilst we consider what specifically happened with those two accidents, we also consider, is there something in this, pressure that pilots potentially feel, depending on their experience, and we felt it was necessary to address that situation.
Okay, so which of those provisions in the instrument go to pressure? So obviously pilot experience.
Pilot experience, and one of the observations that we have, or the information that we can rely on, is that, and it was referred to earlier, clearly pilots who have a CPL or an ATPL who are conducting AngelFlight activities have been trained to a different standard.
Sure.
And a part of that is human factors. So they have already received some training that assists them in handling pressure situations. Whereas in the private community, let's say, of pilots, we're relying on education material, which we do provide, around human factors to try and educate pilots.
Just narrowing it down to the instrument. So the instrument says that 400 hours in an aircraft, 250 hours in command.
Correct.
In the case of the Gambia flight, they had 530. Pilot had 530 hours.
Yep.
900 and something, 40 or thereabouts in the Nile flight. I'm just going to, if you're talking about pressure, that clearly wasn't a part of those two accidents in terms of that they already had well in excess of those minimum hours. I'm just trying to explore the nature.
So essentially the individual involved in that accident cleared the hurdle rate. Sure. That's correct.
Yeah.
The other thing to consider though is when we produced this instrument, there was, let's say, requirements, I'll use the word requirements, but not necessarily enforceable requirements that AngelFlight had in place. But this instrument's for all of CSF.
Yeah.
And we had to also consider if there was to be any entrance in the future.
Sure.
So that was one of the reasons why we specified minimum
I'm happy to
standards.
concede that much of the instrument, in some sense, doesn't cause detriment, and it places at least a minimum standard.
Yeah.
But I struggle when I look at the instrument to find, and this is not a criticism, just I struggle to find provisions that you've placed in here that directly address, other than night VFR, and I do know that flight wasn't at night, it was just prior to
Entering night.
last light. Maybe I should just go to the ones that I think that I have a problem with.
Sure.
Okay, so I don't have a problem with mandating minimum hours because I think AngelFlight does that anyway. It doesn't have an effect on them. Would you concede, after hearing the evidence today, that the instrument as it currently stands prevents a mentoring pilot from being in the aircraft, and that's actually a bad thing?
We actually wouldn't agree with that.
Sorry, you don't?
No, we don't agree with that.
Okay, can you explain that more? Because AngelFlight are basically saying they can't put a mentoring pilot into the aircraft, which is clearly something that would go to culture, would go to pressure and experience.
Before I let Mr. Moran,
Sure.
he'll provide a more detailed response, but our position is that if we want to put another pilot in the plane to be present with an experienced AngelFlight pilot, we have no objection to that. And if that's to help introduce that individual to how to conduct flights on behalf of AngelFlight, we're comfortable with that. All we ask is that it needs to be clear who is a pilot in command, right? Because you can do it both ways, if you know what I mean. It could be pilot A, could be the experienced person on a particular aircraft and the pilot in command, but not experienced at doing angel flights, and the mentor pilot's not in the control seat, or it could be reversed. So we have no objection to doing that, and we would say that the term operating crew and the definition of operating crew actually allows them to do that. It also allows them to have a pilot in place that's just assisting with some activities on behalf of the pilot in command. But I'll ask Mr. Moran to expand.
Just the provision, just so the committee is clear, says the aircraft does not, basically you must not operate a flight unless the aircraft does not carry on board any person other than the patient mentioned in one of the other paragraphs, so the patient and any other passenger who accompanies a patient to provide support and assistance, and the operating crew. That's the only people allowed on the aircraft. So clearly there's some confusion here, perhaps with AngelFlight, that could be clarified.
Certainly, and we've had that discussion, but perhaps we'll have it again. The pilot in command has the ability to designate someone as operating crew to assist them, and one of those functions could be filling the same role as that mentoring, which we've had discussions for some time in that we believe that is beneficial, like you described. Having anybody, for example, if you're flying into a more congested area you're not familiar with, taking somebody with you who is familiar with that only enhances the safety of it. We have no objection to that at all. So we believe the instrument is written gives the latitude to the pilot in command to be able to designate someone and bring them along.
Okay, so if there's an accident, the operating crew is defined in law to include, because that's obviously where the things unravel, is after an accident's occurred, and that would prevent perhaps AngelFlight operating in a way contrary to law. You say in law that the operating crew can include a mentor. Where is that? Is that spelled out anywhere?
Mentoring, there's no no aviation definition of a mentor. It's not an endorsement. It's not a license.
Okay,
It's a colloquialism that people use in the community, and that's why we specifically say operating crew versus crew member versus pilot in command. They all have different definitions of mentoring. We believe, though, has the latitude to fit under and meet the operating crew requirement, meet the same outcome you.
Is there anywhere in writing that says that AngelFlight could rely on? Is there an instruction somewhere in law where that?
We don't because we don't define mentoring, because it's not something we have endorsement. I can't say that I can't give you a clearance to do that, because that's not a category. I can talk about operating crew, and in the narrative back.
But a definition of operating crew that would allow for a mentor to be part of the crew. Yeah, sure.
I mean, I understand your question, Senator, and it's a good question. And as Mr. Monahan said, it's probably an area that merits further exploration to make it clearer. But our position now is that, as defined in the civil aviation regulations, a member of the operating crew is a person who is on board the aircraft with the consent of the operator of the aircraft, which would be the pilot in the case of a private operation, and has duties in relation to the flying and safety of the aircraft. You'll look at that provision, and it's followed by a number of notes. Now, actually, these days, notes are considered to be relevant to the way you interpret it. CASA interprets this provision, and we have made it clear, and I think in a discussion that Mr. Monahan was hoping to have, that from our perspective, a person who is genuinely being mentored, not a legal definition, but I think we share an understanding of what's involved, as opposed to taking the opportunity to fly in the aircraft for some other reason. If it's genuine, we would interpret that person, we would interpret the rule as applying to that person as a mentor. If that needs to be made clearer, as a matter of law, we are more than happy to entertain
so that may be something that could flow a recommendation from this committee to look at that, and you would look at that further. Because
but in the meantime, I think we're on solid ground.
You know that I have a disallowance on this instrument, and actually it wouldn't take much to remove that disallowance, because I get you're trying to create a minimum standard. The other one I have a problem with that in my view causes a problem is the one relating to maintenance. Okay, you place an extra maintenance requirement on an AngelFlight aircraft that in neither of those accidents had any part to play, and has no part to play in pressure, which is one of the issues that have been raised in the ATSB. And removal of that, I think, I'm concerned it places a burden and a deterrent on people who are pilots, qualified pilots with aircraft that meet the normal safety requirement to fly. It creates an extra burden. No matter how small, it does create an extra burden.
So perhaps I could respond to that as well. So when we wrote our instrument, as you recognise, we were setting a minimum standard, and we felt at the end of the day it's a system of safety, and we felt that we also had to look at maintenance and consider that in the safety system.
Is there a safety case that you've generated for that?
I think the other point I would like to make is that we believe that what we've proposed or introduced isn't too onerous, because it's 100 hours or 12 months. If there's data that can be shown to us that suggests it's over onerous, we could look at that. We're happy to look at it, but our understanding is it's not. And if you think about it, if there's people who are doing typically more than 100 hours in 12 months, which we understand to be a very low number of people, potentially, I think we believe it's less than 10, but we might be wrong.
Well, I've got the CEO of AngelFlight behind you, nodding your head. Sorry, shaking your head in disagreement.
Okay, but I just want to make the point.
I think Dr. Crease.
Could I just make one point though? Yeah. So we introduce, let's say, the 100 hours, and you hit 100 hours at month 10. So you've been able to fly for AngelFlight for 10 months out of 12, and I guess the decision is whether you do your maintenance at month 10 or wait 2 months.
But you know that before the Parliament, and it's a government bill, it's passed through the Senate, which means it will pass through the lower house. There is a general direction from the Parliament saying you now also, safety is paramount, but you have to consider the effect it has on the business operations as well. I put it to you, the ATSB report, neither of the ATSB reports go to maintenance. Unless you can provide a safety analysis that got you to the point of imposing this particular new criteria, which I understand, I know Dr. Creese has pulled out of flying because of that particular requirement. Where's the analysis that got you to that point? Can you please table that analysis? You must have done some. How did you pick that?
When you look at the average number of flight hours by private pilot in Australia, it's roughly 40 to 45.
So you have this laid out in a safety case?
Yes.
Okay.
We'll provide that.
Very simple question.
Yep.
Can you provide
Yes.
that to the committee?
Yep. Yes.
Because, as I said, I think I'm close. I would be willing to withdraw the disallowance, understanding you're trying to put a standard in place, which is actually already met by AngelFlight, but you are placing a couple of onerous elements, albeit one caused by ambiguity, on the organisation, which would be harmful to it.
The ambiguity issue can be readily addressed, and as I said, in the meantime, as we're the interpreter and applier of that rule, it takes that. I might mention too that in addition to the analysis that Mr. Monahan referred to, as Mr. Crawford indicated, we did look at what was going on elsewhere. Of the 10 criteria that the FAA applies when assessing exemptions for the purpose of AngelFlight or public benefit flights, as they're called in the U.S. Of the 10, one of them is imposing higher aircraft airworthiness requirements. We looked at the kinds of considerations that authority took into account, and amongst the others we've mentioned here, that's among them.
But recognising that GA around this country has suffered at the hands of CASA and regulations, and the Parliament has now acted, or is being a stroke of being able to react to that, it seems to me that you are looking around for something that demonstrates that you've done something, but actually there's no justification for it on the evidence of operations here in Australia.
I think Mr. Monahan indicated the kinds of information that could be provided to support that for what is a relatively modest, I should say, intervention. It has an impact, but we believe it's balanced by the safety benefit on an analysis that was presented, but also on the basis of assessments by other authorities who are looking at the same things. None of the accidents that the NTSB looked at that gave rise to the result that the implications here involved a maintenance issue. None of them did. And my understanding is, and I'll defer to Mr. Monahan on this, of course, is that the requirement effectively brings forward what would otherwise be an obligation rather than creates a new maintenance-related obligation.
I'm sorry, would you just repeat that?
My understanding is the requirement in the instrument, rather than introducing an entirely new maintenance-related or airworthiness-related requirement in terms of the 100 hours or 12 months, it simply will bring forward the period of time within which maintenance needs to be undertaken.
But if someone has to do maintenance at a particular point and then 6 months later has to do maintenance again and then 6 months later again because of the trigger, that involves additional cost.
It does, but I think it was a balance. But
yeah, and look, I think...
Well, when you table the safety case, I guess we'll see the balance.
Yeah, and look, I think the other thing is, the 100 hours and the 12 months periodic inspection is a well-established solution across the globe. It's been in place for a very long time. And,
with
the purpose...
With community service flights, you say?
No.
Well,
please, just bear a minute.
Yeah, sure.
Hear me out.
Sure.
And the issue for us is that, we are often encouraged by industry to look at best practices elsewhere and adopt them, and that's what we've attempted to do when we did our analysis and looked at what the FAA do. I would also point out that in most jurisdictions, the FAA insists on these flights being conducted under IFR, which we have not done. But back to the maintenance, our objective is to make sure somebody's not flying an aircraft well in excess of 100 hours while conducting community service.
So my understanding is that most manufacturers recommend 200 hours.
Depends on the airframe. You could
Okay,
answer that.
sure, sure.
And if you're on the 100 hours, if you're on a OEM scheduled maintenance, or you're on a CASA approved scheduled maintenance, then that 100 hours doesn't apply.
That's right.
I can see the chair's sort of looking at me. She has given me a lot of time.
No, I'm actually encouraging you
Okay, all right.
because I think this is a very key point why that piece of legislation, that the legislation was amended to consider cost, and by bringing forward any maintenance schedule, you're potentially increasing the cost for maintaining that aircraft to greater than within 100 hours. Cost of operating private aircraft in Australia is one of the several reasons that is bringing the industry, having people leave the industry and sell their aircraft. So I think this is a very important point. And I just want to check, Senator Patrick, is this not a question that you have asked previously at another hearing?
So I've engaged CASA previously on some elements of this, but not informed myself by the ATSB report, because if the ATSB report had mentioned a maintenance issue, that would have changed the scenario. So,
but you have previously asked for the basis for the maintenance report, and it's not been forthcoming.
Yes, I understand. I have actually. So I think that was taken on notice. Thank you, Chair, for helping me out there. The other point. In your analysis, have you looked at the cost aspects of this?
Yes.
So when we get that safety report, we'll get to see what the cost implication on the user would be in respect of these.
We're very confident we took a pragmatic and proportionate approach on this instrument.
Well, okay. So the instrument I think it's got 11 days standing, and I'd like I think that will take us to probably the sitting week afterwards. I'm happy to sit down. I know that Mr. Carmody, when the instrument was first brought in, helicopters were in there, and that was changed almost immediately, and I'm grateful for that.
Yeah.
It made it
I don't believe
an improvement.
used it, just so you know. But
sure, no, I understand
okay.
that, but once again, we don't want CASA making regulations or placing restrictions on things just for the sake of it. That's
to be candid, we didn't place a restriction on it. It was an oversight.
Sure. Okay. You didn't add the word helicopter. Okay. I appreciate that. If you're able to table that, and I'd give you the offer of having another discussion with you offline, because I get what you're trying to do with the instrument.
Okay.
Just cognizant of what the Parliament has done, or at least the Senate, but I'm sure that the House of Reps will also say shortly. We're trying to grow this industry. It's been collapsing for some time.
And we recognise the cost aspect of maintenance. We also have to recognise our concern as in a 12-month period, if somebody goes over 100 hours, well over 100 hours, is there a potential risk to the passengers? So that's where that's our rationale.
All right, thank you, Chair.
So, Senator Patrick has specifically asked for this rationale before.
To be honest, if you have, I'm not aware of that. This is the
Okay,
first time you've asked us about maintenance before, and we've had that discussion.
We'll certainly respond.
But specific on this one, we will.
So I want to.
Yeah.
Well, certainly, I'm certainly happy to respond.
Yeah. So if you refer back to the additional estimates day, Senator Patrick specifically asked Mr. Carmody for the statistics and how those regulations would have altered those statistics. So I think it's quite specific, but if you could please respond. And I would suggest, with a matter of urgency, I would also...
Can we set a date for questions on notice? We probably should do that anyway.
Could we... 2 weeks, questions on notice?
Sure.
That would be... Thank you. I would just flag that issue that's just been raised, you're trying to balance safety. I think there would be nothing safer than nobody flying.
And that is where... Objective.
Well, I would encourage you to review that objective in line with the reality of what's happening.
That's a phrase that's often used. That's certainly not where we hunt.
No, but it is... I appreciate you may not think so, but it is the result, the outcome of where we're at is the number of pilots who are leaving the industry in GA and the flight hours that have been.
Well, I think the flight hours, again, we believe our instrument is very modest, but we've obviously been asked to look at the maintenance aspect or provide a justification.
Thank you.
Be specific, just say, you did answer that, but not with a safety case. I want to see the
why.
Sorry?
You want to see the why.
Yeah, the why.
The rationale.
And whatever you have, if you're in doubt about whether to send it, send it.
Thanks. I'm sure the evidence will be there,
Chair?
Senator, but I might point out that, and has been said a few times, our objective here is not specifically to address what caused those two accidents, but what are the kinds of things that can cause incidents and accidents of this kind. We're being prospective. And if we were to wait for sufficiently robust data to support an evidence-based decision for every individual decision we took in this space, we would have to wait for a dozen more accidents to occur.
Bar for the difference of the pressure, which which ATSB has talked about, we are talking about CASA licensed pilots in private aircraft that are otherwise considered safe in any other operation, and you are imposing an additional requirement on community service flights.
But similarly recognized in the Federal Aviation decision, policy on this, that a private pilot license is an entry-level requirement, and that community service flying is different.
Can I just tell you, I think our pilots would love to have the FAA regulations dropped here in Australia. We'd get rid of all the CASA stuff and we'd have a much happier place.
Well, in this particular
so
space...
You're cherry picking.
No, but I'm just saying, in this particular space, though, Senator, I think we are more modest than the FAA is.
Thank you, Chair.
Senator Rennick.
Hi guys. Look, I'm just got a bit confused, so I apologise for my confusion. Were those accidents a result of maintenance? Were they a maintenance issue? Because my belief is that they were a pilot error.
Correct.
Okay, so with that, are you imposing extra maintenance requirements on AngelFlight?
We have imposed some modest additional maintenance requirements, yes.
Okay, right. So why?
Senator,
yeah.
I'm sorry, it's not on AngelFlight, it's on the pilots.
It's
of
on the
those aircraft.
CSF, yeah.
It's on, no, it's exactly. So it's not on AngelFlight.
And is it just AngelFlight or
No,
all
no,
flights?
all community service flights.
Right.
So when we use the term CSF, we're referring to the whole segment.
So
There's
why are
two,
you putting, I know we've just discussed this in detail, but so what, just briefly summarise why are you doing it again?
So when we...
Why are you imposing extra regulations?
So when we constructed the instrument, part of our process was to also look around the globe to see what other regulators were doing in this space. And we're often encouraged by the aviation community to look at the FAA. And we did look at the FAA, and if you look at what the FAA has, it's essentially...
So will these additional requirements, do they prevent the accidents from occurring?
Those two specific accidents?
Yeah.
No.
Right.
But they may prevent an accident in the future from happening.
Mate, yeah.
They go to the core reasons why accidents happen in the private sector.
Right.
And the instrument addresses fundamentally the top 4 to 5 in some capacity in very small amounts, not in effect to close it all completely, but hopefully just to break the chain enough to turn the dial just a little bit to the right that will enhance those somewhat different operations they're doing by the private pilots that don't have the luxury.
No, that's fine. Yeah, no, I just wanted to...
No.
There's no connection. Yeah.
So, Mr Monahan, just to go on from that, so did I understand you correctly that you just said that most accidents in the private aviation space happened as a result of reduced maintenance or poor maintenance? Could you just explain your answer?
What I was saying is the accident themes that happen through each sector of aviation have different themes. The number one across the world globally is control flight into terrain. So those are things flying into weather when you're not qualified. What qualifies that? So that is the biggest accident, the biggest killer of people. So that's the first place you look. So you've tried to find ways to address the most likely case of mishaps in the future for a particular sector or cohort of pilots. That's the discussion.
Right, so it wasn't around maintenance?
No,
Okay.
not, and we'll address that in the comments when we come back.
So just on that, ATSB has produced a document given that that is the number one cause of accidents, did you take any steps to distribute that document to your pilots?
Sorry, which document are you talking about? I apologize. The mishap report or the?
No,
or the VFR information?
The new brochure that they just tabled, which we're just going to get you a copy now.
I won't know. I'll have to check with our stakeholder engagement to see if we did. But if not, it's something we can certainly make a link to.
We do provide a lot of guidance material around human factors. So we actually we did something like 220 aviation safety seminars last year. This is where we go to remote locations. In fact, we're doing one in Rockhampton next week, and we get local pilots to come in and we try to educate them on the risks.
It's on our website.
Yeah, so, and if you go to our website, we've got a number of tools, safety behaviours and human factors. So we have a lot of material actually available to the pilot community that they can utilise to their advantage.
And I see this was updated last month, so I can check with our stakeholder engagement. We certainly try to get it out. As you mentioned earlier, we have access to pilots through our database to be able to inform them to go to the website and look for things. So
we might even be able to put an electronic version onto our website as well.
We can look at that.
We're happy to do that. Anything that's in the interest of aviation safety, we're happy to do.
I would recommend that.
Sure. Yep.
Can I just ask, sorry, on that, such a good question, and now I've forgotten. Senator Patrick.
I'll take over very briefly. You mentioned you're going to a workshop next week.
We're holding a
seminar.
Yeah.
Mr. Morgan previously said you don't get many people turning up to those.
Well, we had 8,200.
Sorry, can you say that again?
Over 8,000 people at 200 seminars last year.
Okay.
So I think that's significant.
Okay. Mr. Alec, can you help me? This is slightly off topic, but well, it has some relationship. Assuming the CASA amendment goes through the lower house, and it is a government bill, which now requires you to consider the effect it has on general aviation, any regulation has on general aviation. Firstly, do you now do regulatory impact statements on when you create regulation, when you change a regulation, and secondly, will that change after the bill goes through? Noting
we are currently subject to the requirement to conduct regulatory impact statements where we're obliged to do so. There are processes for exempting from that process, but we have to satisfy the Office of OBPR on that before we can do it.
So was there a regulatory impact statement for this instrument that's been tabled?
No, there was an exemption for that.
Who granted the exemption and on what basis?
I remember what the acronym is. Office of Best Practice Regulation issued an exemption for that on the basis of the fact that the impact was considered to be minor.
Okay. Is it possible also for you to table any correspondence you've had in respect of that exemption, and so basically the request for the exemption and indeed the response back, because that might be another area that the committee would be interested in, because and I presume after we go through this change in legislation, there would be a requirement, perhaps a more stringent requirement for you to do a regulatory impact. Those exemptions won't be quite as easy to get.
Well, I don't know that there's an exemption under the proposed legislation to begin with, but the terms of the proposed amendment are different to the terms of the RIS. They're quite specific, and we are very mindful of what that will involve, and we're turning our mind to it already in anticipation of what we expect will be law.
And so how will, I'm sorry, Chair, and this was with your indulgence, but it goes to creating regulation without publishing impact statements. When the new bill comes through, how do you intend to change the approach of CASA? Maybe that's for Mr. Crawford.
May I take that on notice, that the analysis of what sort of things you take into account and how you weigh them up is not strictly speaking a legal issue.
Sure.
What we're looking at now is what would our obligation be if those provisions become law, bearing in mind that they are prefaced by subject to the safety requirements.
Of course, safety is paramount, but that now there's a new consideration for you.
And we're well aware of
I think the committee would be interested in your initial thoughts on that. even though the legislation hasn't gone through the lower house.
Well, those initial thoughts wouldn't necessarily be mine, but we'll
Sure,
take
no, I
we'll
understand
take
from the
notice.
call.
Can I just go back to, I did, thank you. Just going back to the training that you're doing in Rockhampton, and particularly given it's in my state, so how many do you think you'll get to that training?
You know, we broadcast it on our website that the training's happening. All I can tell you is last year we did about 200 training sessions.
Yeah.
Or, you know, we do provide training, and we also share safety messaging.
Yeah.
And of those 220 last year, we had over 8,000 people came and participated.
How many pilots do you have in the industry?
There's about, in total, there's about 30,000.
Right, okay, so...
But bear in mind, some of them are, you know, if transport pilots most likely wouldn't come to these sort of events. So when we're doing these events, we're typically reaching out to the private pilot and also the aerial ag business, you know, trying to get to people who it's the best mechanism to try and provide education or guidance that may help them avoid an accident. That's really the primary purpose.
Okay. Well, I think I've run out of questions. Senator Antic, you haven't come up with one?
Can I just get you to perhaps provide some further statistics on who turns up to your training sessions?
Sure. I think we have it in our annual plan.
Yeah.
I think it's actually...
And so who turns up, and you know, I guess some people do multiple.
Yeah. And some people
courses,
can turn up. Sometimes it may be people who are also interested in maintenance. You know, so there's a variety of people who may attend some of these sessions.
If you could provide some statistics on that, I'd be grateful.
Happy to do that.
Thank you.
Just on the number of pilots in the industry, how current would you say your list is? Do you audit your list?
Well, you know, I would say it's fairly accurate because of, well, pilots have to get certain things renewed on a certain basis, like medicals, and, you know, so I would say it's relatively accurate.
I was speaking to a pilot last night who said he hasn't done his, you know, the touch and goes, whatever you call that.
He's not current. Yeah.
He's not current.
Yeah.
So would you be able to divide the list into who's current, how many current pilots there are?
I'm not sure we could, to be honest. What we've been able to do in the past is categorise them between air transport, commercial, recreational, right, private.
There's no legal requirement to be current, but
No.
you can't lawfully operate unless you are.
Yeah.
So there's no report that I'm not current. That's
Yeah.
right.
Now, I guess what I'm interested in is that CASA has very high standards for its pilots and for the maintenance of its aircraft. I'm just hoping that CASA applies the same level of rigour to its own lists and internal processes.
I think our pilot standards and our maintenance standards are pretty aligned with the International Civil Aviation Organisation, to be honest.
Our licensing data, as I understand it, is drawn from the record that we keep on that. So I can't imagine there'd be a discrepancy of any significance
No, I
between
wouldn't have thought so.
the actual pilots.
For example, I have a PPL license, and but I haven't flown in 20 years. So
Is this a confession?
You wouldn't want to
Don't
fly
follow
with
me
me.
up.
But my understanding is their license is perpetual, and so the better signal, as you suggested, is probably medical certificates.
Yeah.
Because they're
Because it'll tell you who's active.
So rather than telling us the number of pilots, is it possible to tell us the number of
Active medical
active
possible,
medical
yeah.
certificates?
We'll take that on notice.
And perhaps over the last 3 or 4 years,
The
if
question is
possible.
about the granularity of our statistics, right?
I mean, we have a similar challenge with aircraft, as you may appreciate. People register them once.
Yeah.
And so we don't actually know how many of the aircraft are truly active.
Would you know how many are up to date with their maintenance?
Not necessarily, no.
There again, the requirement is not to operate an aircraft if it is not complying with the applicable maintenance requirements. And so it is the obligation of the certificate of registration holder, if the aircraft is going to be operated, that they have a maintenance release and do those things. But there's no explicit compulsion in law, maintain your aircraft by this date. You just can't fly it if you haven't.
And the
lawfully.
pilot in command is responsible for ensuring the aircraft has a current maintenance release.
But you're going to introduce an instrument that says that you have to maintain your aircraft more frequently or to a higher standard for the
The instrument,
utilisation.
the instrument imposes that requirement on the pilot in command of a community service flight, whereas the existing maintenance requirements are on the certificate of registration holder. So the obligation then is, if you're going under the instrument as it is, if you're going to conduct a community service flight as a pilot, it's your obligation to ensure that the maintenance on that aircraft meets the requirements in the instrument. So it's a specific obligation on the pilot.
Yeah. Just as is your obligation to make sure that you've got a current medical and your licence is current.
There's just something that's bothering me about the record keeping for CASA and the requirement on the pilot and the community service flights.
Standard.
Yes, double standard. That might be one way to.
Might be convenient, Chair, if they don't know the state of the GA industry.
Dear. All right. Unless anybody has any more questions, I think we'll look forward to your responses within the 2 weeks, please. And yes, see you at estimates. Not too soon after that.
Yeah, October.
Yes.
My favourite time of the year.
We look forward to it.
Do you? Very good. We can't be trying hard enough then.
Thanks, Senators.
Thank you. So, that concludes today's proceedings. Thank you to all witnesses who appeared. Thank you to Hansard. Thank you to Broadcasting. The committee stands adjourned.